Right, good day to all of you and welcome, a warm welcome to this webinar on public health and responsible innovation in a post-COVID Europe. We have well over 200 people who are either registered to be here in the room or watching on YouTube, and no doubt there'll be many more that will watch the YouTube recording afterwards. The event is clearly timely. Europe, the world, is facing a major health crisis that has made us reset, if you like, our focus within health on public and preventative health, to focus around communities, around behaviors, around people, and around lifestyles. And we are, of course, helped in this mission of refocusing our thinking by the much better communications technologies we have, and of course the range of technological tools that are available to us as well, to help us as professionals involved in the field, or indeed to help us as patients and people who want to access services in new ways with increased knowledge about ourselves and our bodies, and some more choices around the technologies that enable us to stay healthy and hopefully live long lives. And also, of course, to be the recipients of some traditional kinds of healthcare when we need it. So there are some procedural things, if we can go on to the next slide, please, that we do need to cover. Oh yes, here we go. Well, first of all, there's three of us who are the main people you may see during the course of the event, and I'm very grateful for the help of Lydia Montandon and Eva Schucker to help me, Malcolm Fisk, with regard to the arrangements for this webinar, and of course the drawing together the speakers and things like this. We have got people in the background who I should mention as well. We have Barbara Hofleitner, Angelo Spork, Heike Vogel-Porschel in the background who you probably won't see, but nevertheless are essential to make this webinar work fine during the course of the afternoon. First of all, yeah, we do have a glittering array of speakers. Well, I'll come on to them in a moment. But let me just briefly introduce myself. I am Professor of Aging and Digital Health, so I actually cover two areas that are probably going to be mentioned quite a few times, older people, of course, being very major consumers of health services. I'm also involved in the Live In project. Can we move on to the next slide, please? And just with regard to this, actually, more on the admin. First of all, can you use the chat function for any questions? We will pick up on these, and the questions will either be fed to the speakers by my colleague Ava, or indeed she may invite the person who is posing the question to actually ask the question themselves. Please can you mute yourselves during the course of the webinar to avoid background noise, and by all means keep your camera on, but certainly we'd like you to switch on your camera when the moderator addresses you, but bear in mind, as I say, this is going out live on YouTube as well. Next slide, please. Yeah, responsible innovation, yeah, that's the key to today's event in the context of public health. Living Innovation Project is concerned with the way that we will live with technologies in the year 2030. It involves 14 partners, including strong commercial partners, and you can see some of them along the bottom of this particular slide. And as indicated, we are concerned with the way that companies actually are responsible in their approaches to the development and the application of technologies in this particular field. Next slide, please. There are a couple of upcoming events which you may be interested in, that both of which relate to the health and well-being fields. Next week, how to include people with blindness and low vision in innovation. Important issue here, and an important theme is being hinted at here about the engagement and involvement of users. And also next month we have a very current, very pertinent webinar concerned with balancing work and health when remote working in a post-COVID world. Mind you, we talk about post-COVID, there's probably quite a long way to go with regard to this agenda, so a very, very important event. Next slide, please. And I'm going to say a couple of things of introduction before I go on to introduce our first two speakers. We won't be introducing our speakers at length. You have access to information about their biographies. and clearly what they have to say will be a demonstration of their knowledge and expertise in the particular areas. But I'll come on to them in a minute. Next slide, please. Yeah, next slide again, please. Yeah, so I'm going to set the context here. First of all, I kind of touched already on the fact that there are some health imperatives here. We are emphasizing more and more preventative and public health. So we have got a broader health agenda, if you like, than probably was the case a few years back. There is the parallel drive to reduce costs, which is one that we have to have in the backs of our minds, I suppose. And one element to that I would consider valid is the way that people can be empowered by technologies to self-manage in different kinds of ways. So that theme may well come out during the course of this webinar. We are talking about changed health paradigms as well, because the technologies can, of course, empower people more and more. And so it does kind of question some of the older top-down approaches sometimes that are applicable in the field of health. And we could argue the case that there's more outreach because of our technologies and the communications networks to be able to address health inequalities. And I put a question mark on this slide because it's not certain that we'll be able to actually do that. And it may be that in some respects, disadvantage may be hidden because of the digital tools that we have, because it won't be quite so geographically focused. But it's an interesting one that we may discuss a little bit later. And yeah, the point about individual responsibility and self-management and digital health tools quite clearly in the mix there. And most countries, or certainly most Western countries, are looking at national strategies to promote their adoption. Next slide, please. New tools. This review was done about 2 years ago in the UK by Eric Topol, who's an American cardiologist. But the listing is a useful one for us because it kind of summarizes all the different things around technologies, all the different technologies, I should say, that we need to consider and will have a role in future healthcare, whether we as users, as patients might want to access them, or whether it's healthcare services providing us with the services that we want. I won't go through the list, but you can see there are things around telemedicine, around wearable devices, around the use of AI, around robotics and genomics as well. And of course, lots of companies, some of whom are watching this webinar, are concerned to make sure that their products kind of fit within this kind of new landscape that is being set up for probably all our countries. Next slide, please. Responsible innovation, things that will come out today, perhaps. I mean, but clearly to be responsible means knowing the market and being sensitized to those changing health dynamics that I've signaled already and will come out later. And it also means quite clearly meeting legislative and regulatory requirements. You cannot now ignore, by the way, some of the other broader agendas that derive, if you like, from CSR, corporate social responsibility, through ESG, environment, social and governance issues, and the United Nations Sustainable Development Goals, out of which, or among which, by the way, are things like responsible production, good health, combating poverty, clean water and sanitation. So these things are all coming into, if you like, the health landscape we're concerned about, but also sustainable communities. And I wanted just to touch, before we get started, on the word sustainability, because a lot of people will use that in terms of, and UN certainly do, in terms of sustainable communities, sustainable society, whereas some companies will be thinking more of sustainability in terms of their financial viability and so forth. And now both, of course, are very, very valid, but we need to be clear about when we talk about sustainability, which of those we are talking about. Early outcomes of the Live-In project, I'm not going to go into depth in these because clearly we want to tease out some of the issues with you today, but they do include things like being sensitized to risk. So being very, very aware of the potential impact of the technologies that are being developed. There are issues about very much involving users in the design process, the co-creation element of design, and also making sure that linked with that is the design for the usability of those devices for the widest range of people. And there is increasing evidence, and people like McKinsey and Deloitte are actually making this point very, very strongly, that to be responsible in these kind of ways actually does make commercial sense in terms of profitability and financial sustainability. Next slide, please. And just coming to the end of my introduction, just to say that our objectives for today are to explore and we've got some sessions, of course, where our speakers will be debating some of these issues, aspects of responsible innovation that can apply in the public health sector. And the outcomes of today's webinar will also feed into the final project outputs for the Live-In project, which clearly we want to use to influence European agendas, and there will be various published outputs from this, we hope, that is going to make an impact. Next slide, please. This is our glittering array of speakers. I just need to point out that we have lost one speaker in Annette Kleinfeld through illness, unfortunately, but we also are grateful to Beatrice Alano for being a last-minute replacement as well for the webinar today. So very much grateful to them. As indicated, we won't be introducing them in great length, but nevertheless important, a range of people who can bring different dimensions to the issues that we are concerned about. Which leads me on to the next slide, because this will enable me to introduce, first of all, Matthijs Zweer. Now, he is a partner of the municipality of Utrecht, as you can see there. He's a former senior nurse, and who I found actually described as both a transition coordinator and a change agent. And I'm also going to mention now, before this session as well, Eman Martin Vigneurt, because she will speak straight after Matthijs before we get into a bit of a debate, because she's head of political affairs and government relations at Bosch UK. Interestingly, and clearly her presentation will reveal this, she is something at the cutting edge around issues of 5G, whilst most of us are still trying to get used to 4G, in the context of the Internet of Things and in the context of smart cities. So they together bring together, if you like, a community and a commercial perspective, and it'll be interesting to see whether there are any, well, where the common ground is and where there are some difficult areas that perhaps we could take a few steps towards resolving or having a view on. Matthijs, I'm going to leave it to you. Far away.
Thank you so much, Malcolm. Just a quick introduction. It's stated here, strategic partner at the municipality of Utrecht, but also the first 10 years of my working life, I worked as a senior nurse in an academic hospital in Utrecht. So I'm quite familiar with the primary process of the more specialized health. In the last 10 years, I do different roles in and around healthcare, and in an advisory role or in different roles to make a change, make a transformation, and better health for everybody, or like one of my employees said, BCP. Happy civilian, happy patients, happy clients. And I will start to share my slide now. This is a little bit inconvenient for the organization because I altered my slides 5 minutes before of this presentation. So I will share my content. I think I've done this a few times now, so I think this will go perfectly right. This is a highlight of the beautiful city of Utrecht. And I will go to the next slide. So this is Utrecht. It's the fourth largest city in the Netherlands, and it's a fast growing historical city in the center of the Netherlands. In the year 2022, we will celebrate our 900th anniversary. Currently, we have roughly 360,000 Utrechters, and we will have grown to 400,000 citizens in 2024. Which means we have encountered a lot of challenges in between, also regarding public health. Thinking about these challenges, we are very proud that Utrecht decided almost 2 decades ago to put healthy urban living for everybody as a policy statement in all their policy. Now this becomes visible in different levels. Last year, our new public health policy was accepted by the City Council. And in Utrecht, we look at health from a broad perspective and a positive perspective. We are aiming towards health in all policies, health equity in all policies, and we work on these themes as poverty and behavior to make this city a healthy city for everybody. To achieve all these ambitions, we collaborate and co-create with citizens, professionals, experts, local, regional, national, and international organizations and initiatives, and we believe in sharing knowledge and team awareness. Alone you go faster, but we get further together. So Utrecht is part of the WHO European Healthy Cities Network, And in Brussels, we are represented by our representative for health. Health as a main theme for the city of Utrecht. And we collaborate in a dozen of local networks. For me, the important one is the Health Pact Utrecht, as stated above this slide. I have thought about the line in this presentation, of course, regarding to the other speakers. So if this is anyhow about innovation, it's about social innovation. It's about how we act and deal with difficult, wicked problems on a city level, and how a city municipality and their partners could come up with a construct where everybody can contribute to their own health or the health of their neighbors. So I hope you can listen to my story or my experience in that manner. Interestingly, the things that are happening in Utrecht are quite widely spread. And although it's not a big city, we only know half of what's happening in the next area or in the next neighborhood. This was part of the reason why we started the Health Pact Utrecht. It was a wish of our previous alderman who says you are obliged as a city to come up with a policy about public health. But I also have the wish that every Utrechter can contribute to their own health of that of their neighbors. And when we started out and talked to a dozen people, and even at the end hundreds of people, an initiative and citizens, we came up with a notice that almost every street has an initiative on health or on healthy living, but only so many people know about the initiative in the next street. So that was part of the start of our dynamic network. And I've thought of a reason to explain. So this is the way I like to explain. It's a C tree. CT tree is HPU. I hope this formula becomes as noticeable as the one invented by that guy like 100 years ago. The C stands for connect, and the T trees stand for trust, twist, and tell. And I will explain this in the coming slides. Connect, the Health Pact Utrecht, as I told, mainly started out as a dynamic network. We had some guiding principles, like everybody can contribute. It should be fun to collaborate in public health, work with each other in public health should be fun. Should be fun, not always, but it's a great field of cross connections. There are so many influences and factors of influence in public health. So that's how we started. We also started with a coalition of the willing, people that didn't need a book to explain what we were about to do, but just felt the energy of joining in a network and finding crossovers and finding connections that aren't previously there or weren't previously there or are a little bit odd. And within the network, we seek each other out for inspiration, collaboration, and co-creation. So we take an active role to drive this network. We do this by organizing surprising encounters and sharing stories. In this way, we connect people, organizations, knowledge, and initiatives. And with the Health Pact Utrecht, we create a breeding ground where initiatives, alliances, and collaborations are created and taken further. Connections are made both horizontally, in a way of broadening the network. So do you know what's happening in the next street, or do you know what's happening in the other organization which is working in the same field, but also vertically. So as a whole sense of community up, more and more general public steps up and wants to take part in improving public health or public health initiatives. But there are also a group of professionals, the organizations they work in, and local governments or politics, so to speak. And it's an interesting crossover to horizontally connect and vertically connect and try to come up with a shared or common language. The second part I wanted to mention was trust. In Utrecht, there are many health and well-being initiatives and programs started by inhabitants, professionals, and their organizations, municipality and local entrepreneurs, you name it. However, gaps are seen as well. in reaching specific groups of inhabitants and in missing linkage between initiatives. Impact can be increased once knowledge, expertise initiatives are co-created and combined. The Health Pact Utrecht organizes and facilitates this process by providing a platform for individuals and their networks, specifically focusing on experienced knowledge and the perspective of inhabitants, and linking the specific knowledge with researchers, professionals, entrepreneurs, and initiators. Equality is key word in this. Co-creation, partnership, and the creation of space and possibilities, for example. Continuous consultation in policy making as opposed to one-off request. Facilitating social strength, that's already there. Rely on ownership, responsibility, and context-specific expertise. In short, trust. And this sounds quite conceptual, but it's based on a few simple rules. If you have an initiative, don't bump into each other. Just allow some space for the other initiative to take place. Don't get too far away from the other or the center of the flock. That's why the swarm picture is here, of course. And the last simple rule is fly in parallel direction. Follow your dominantly path of your neighbors. And that allows, like we all know, quite intricate forms in swarms of birds. But this is the same effect on people, citizens, initiatives, if you trust each other and respect these simple rules. The third one is twist. And twist is, for lack of a better translation, twist was for me about turning it around and turning it upside down. Shift the focus toward the things that really matter. Show courage and decisiveness. Shift the focus from illness and care towards the focus on health and behavior. We believe that prevention and precaution are very important, and we are committed to this extensively in actions and in policy, and we also propagate this. So if prevention is really important for a city, you should put effort in the fact that not just 5% of your annual budgets goes into prevention, but make it 10, 15, 20, and have a vision on how to shift, twist, turn it around and make it bigger. The last one is tell. And tell, again, my best way of translating telling stories. Tell stories and share experiences rather than justify and explain. Trust is also the key here. Collect stories from the individual, community, organizations, and policy, government. Share stories with each other, open up dialogue, and explore all perspectives. Find richness in stories and these multiple perspectives, and also use stories to identify problems, to supervise, to find out solutions, and to determine impact. In short, tell. So this was the basic principles of how we run with a group of ambassadors and the network, the Health Pact Utrecht. And of course, if I talk about tell, we have all kinds of stories to tell and things to show you. So this is just a brief in the time that I have left. This was the Healthy Ideas Festival. The Healthy Ideas Festival was a festival where 150 contributors contributed to the festival. 99.9% were Utrechters. There were 20 small pitches on orange crates. There were 15 tables where your idea could be developed even further. You could gain expertise or information or advice from other groups. And there were interesting crossovers, like people from the green department up until people from arts and culture who shared the general belief that health is everywhere, everything is health. The Healthy Ideas Festival will be having a second edition at the end of this year, together with 12 of our ambassador partners. Another one is the Health Pact Pledge. These initiatives in the Netherlands aren't standalone initiatives, but on a national level, we made a pledge with the partners in Utrecht that we will contribute to the health of every single Utrechter. And that gives you something of a little bit more body. And it was a really nice way in Corona times to share this with each other. So this is one of the things where we try to make impact. The other one is surprising encounters and connections. I mentioned a few about culture and environment and health, but we also seek out interesting places to do that. So the left top is a caravan. I don't know what you, I think it's a motorhome kind of translation. We had 20 of them filled with people that shared stories and ideas on health and public health. And on the right side, you see the back of my head, but I was discussing this with an artist in a theater called Bak. It's a basic activist theater in Utrecht, where we took the stage to talk about public health and share initiatives and stories. And to conclude, this is a picture of the canal in Utrecht, and this is actually the main reason why we do that. This is the reason why we started this almost 2.5 years ago, before COVID. And if COVID learned us one thing, we definitely want to go back to this side of Utrecht. I thank you so much for your attention. And if there are any questions, I think we come up to that later.
Matthijs, that's a great opening to our event. Thank you very, very much. Eva, do we have a question, a quick question before we move on to Eman?
Yes, we have. Gary Redfeather has a question and he would like to pose it himself.
Thank you, Matthijs, thank you very much. I've been following an organization called Buurtzorg. It's a nursing organization that in 2006 started a self-managed principle revolution in local neighborhood care services. And what has been seen since that time is dramatic decreases in costs, increases in healthcare provisions, decreases in access and services to hospitals. And so it's been this phenomenal transformation. I'm curious, is this part of the Health Pact Utrecht, or is it separate, or is it related? Just fascinated to learn about it.
Interestingly, is they aren't a partner yet in the Health Pact Utrecht, but that has a specific reason. I do know Buurtzorg and a few other home care facilities that I joined in another network. I'm a really network kind of guy. I love to build networks. The reason we didn't incorporate the diehard care organizations in our network yet is they already know about healthcare. So when we ask them, they know the specific route in thinking about healthcare. And what we want to come up is an equal power almost in how communities could pick up care and public health in their local vicinity. And that's not by any means to exclude anybody, because we don't exclude, we don't judge, but that's to rely on the Health Pact Utrecht to get some sort of a maturity, and then ask the, how do you say, highly experienced organizations in and around healthcare to join, to be much more of a match in how we discuss our efforts to gain quality and cost reduction in public health. Does that answer your
beautiful
question?
Mindset. Yeah.
Okay,
thank you.
Very quick question before we pass over to our second speaker, because we can pick up on some of these issues in the discussion and debate afterwards. But Matthijs, with regard to care organizations there, well, the question is, the Health Pact Pledge, is this for individuals or for organizations as well then? Who signs it?
It's an interesting question, Malcolm, because it's signed by individuals and by their organizations. But I discussed by building up the network, the dynamic network, that we work with a coalition of the willing. And I always find it an intriguing idea that when I was part as a nurse of the academic hospital in Utrecht, which employed 12,000 people, and I did an international presentation, was I then representing the entire hospital, or was I one of them with a vision on a certain aspect? So I don't know, that's a real good answer to your question, but I think that the individuals that signed our pledge are from the bottom of their heart connected to our vision and our ambition. And I think they have small and bigger challenges in their organizations to get as far with the rest of them. So it's a growing model, so to speak.
Okay, well, we look forward to learning a bit more about that in debate and discussion, and maybe there's a theme there that will be picked up about individuals versus organizations, which gives me my prompt to introduce Eman Martin Vignert straight away to present from the Bosch UK perspective, or actually a more international perspective than that, I think. Eman.
Thank you. Thank you. It's possible to stream my presentation as well. That would be brilliant. Thank you very much. So today we will take you through the digitalization journey from our end. And it's actually not related only to Bosch, but it's generally speaking, is a transformation we're seeing, especially after the pandemic here in the healthcare, but also in other sectors as well. Myself, I'm an engineer, so you wouldn't be surprised if I deep dive in certain areas. I was also working in my former times in a healthcare and had also a lots of common work with Malcolm. Can switch please to the next slide. So what is 5G? And as Malcolm said, actually, 5G is the next generations after 4G, but it's totally different. It does actually revolutionize the whole way we will going to innovate. But let me first take you to explain what is the first 4G. 4G, all communication between human and devices, human and mobiles. When we talk about 5G, is a step further. It's the first, if you like, network, which we are talking about technology designed for machines and systems additionally to human. So it's all about communication between machine and to machine. So it's the first step to have an automated future. And not only that, but 5G also is the first network, if you like. You could slice it, you could buy a spectrum. I wouldn't say like an individual, but for example, certain companies could have and run their own private network. This has never been the case before. So it did revolutionize the way how we see things. And also it is the low latency of 5G, which is very encouraging, the fast network, because the more and more we're talking about technology, we more and more talk about communication between machine to machine, we're talking about big data, and the more we need low latency in the way how we are connecting things. If you switch to the next slide, please. First of all, I would like to tell you about what we as an industry were facing after the pandemic, but as well as how we did calculate this digital transformation will happen before the pandemic. So of course, we all know that as Bosch company, but also other companies, we need to transition from being a company, a hardware company, to be a hardware and software company. And we were looking for this digital transformation that it will happen probably in the coming period of the next 10 to 15 years. After the pandemic in February 2020, we saw that this has been escalated the period that actually we are looking now that the digital transformation could happen in the next 3 years. And you see yourself, I mean, nobody thought that you will be locked down, isolated in your house, but the only way that you're connected to the outside world is actually your network. You're working from home, you are having your work-life balance in home, you're having your Pilates courses there, but you're also open-minded to have your diagnosis of, for example, any problems from the health side you have with your GP. And I can tell you myself, in my former time, I was working for Bosch for the telehealth side of the business. That was 5 years ago. And we had lots of challenges of acceptance, not only from the healthcare professions, but also from the people, because they thought Big Brother is watching me. But that has been transformed, that we are seeing 60% new applicants for the healthcare side, but as well as in other industry areas. Next slide, please. We need to look to the challenges. Not everything is roses. And I hear Matthias, what he also said in his presentation, community should be on the heart of all the technology what we are doing. And that means is we need to be open-minded about not leaving people behind. And if we are saying that, we have to reflect on what can be done even better. If we want to penetrate and also increase the benefits of the usage of technology, we need to make sure that the people are connected. Until now, we have 3.6 billion people are not connected in any sort of form in an infrastructure. And I'm talking about a global impact rather than a national impact. And we know for a fact now that we cannot only look to things only from a local, national, or European level, but rather on global level. And that has been proven through the pandemic, that you cannot solve things on your own. You have to work in a more collaborative global community. Therefore, there have to be work on the infrastructure to make people more connected and also create an understanding and acceptance. I'm sure you know that 5G, for example, there are lots of conspiracy theories running around that, you know, you have a genocide technology there, etc. And, you know, big boys want to control you. So there are lots of myths around this technology. And the best thing is that you need to talk more about it. You need to educate people about it. You need to bring the benefits to their hearts about it. And that means is we need to look to skills. We need to look to also upskilling and transforming the industry, because for sure, where we look in more transitions to automated future, you need to make sure that the community is also transitioned with you. And another point I would like also to mention, and I'm sure probably the healthcare profession will agree with me, we need to harmonize the communication between devices. This is a pain, and we as Bosch, we know that wherever you are developing, need to talk to other devices. To have anything developed in isolation will not be escalated in the right way. And what I'm trying to say is, imagine you have an iPhone, and your iPhone cannot connect you to your, for example, telehealth device or blood pressure device, because the other blood pressure device has a different platform. So you will end up having 5-6 platforms don't talk to each other. Therefore, compatibility is very important, is essential. But not only that, we need to, of course, the more data we share, the more security and privacy we need, but also the more we have to look to the cyber attacks and how could we prevent them. Next slide, please. So I would like to take you, after we talked about 5G and the challenges and some of the opportunities, I'd like to share with you some innovative ideas initiated through the pandemic, but also through collaboration and cross-functional sharing between other industries. Vivaltic is a Bosch product and actually has been done 2 years ago to start to test SARS, for example, or any influenza viruses. And when the pandemic happened, we looked into then developing the device to be able to test COVID-19. And that was in a period of 3 months, we had to make it possible. And the idea of this is actually, you have a lab, we call it lab on chip, that laboratory facilities in one chip. Allow you actually to test lots of things from your blood. And what also very pressure about this product is that you don't need to wait for 24 hours for your results, but you can get the results in an hour. And the innovation here was, how can I even be less than 1 hour for my measurements? So not waiting for an hour, but less than that. And we managed to get that down to 30 minutes. And it is essential for COVID-19 testing at that time. Another example, next slide, please. I would like to take you through it as well, is Vivatmo, and this is a device to measure asthma and the airway of breathing. And some of you probably will laugh when I mention how this all developed. We, as Bosch, as you know, we have 400,000 staff worldwide, and we're almost active in each industry sector. We're very active in the automotive sector as a tier 1 supplier. And we develop our own sensors. And one of the sensors actually, which is implemented, if you like, in the diesel engine to measure NOx treatment and to measure the NOx emission. So when you have more NOx emitted, then you will add more AdBlue to actually eliminate NOx, not to go to the air. The same principle works with your asthma airways. And you could detect if there's anything could actually create, for example, the next attack of asthma. So you could see how actually the use cases developed in different fields could be used in healthcare, but also vice versa. So a collaborative way in a global level, also cross-functional between the industries, beneficial for sure. Next slide, please. Another fascinated area, because we talked about 5G, we talked about machine-to-machine communication, we need to talk about how can I achieve better processes to allow more communications and exchange of data. And this will take us on the bottom of any device you have. And I'm sure you heard about PCB or you heard about circuit board. And we used to have this greener circuit boards. If you, for example, scrap any devices, you would see them inside and they have components and they allow actually the device to work, if you like. Now we're working on ceramic circuit board. And the ceramic is a printed circuit board with ceramic content material, which is highly thermally conductive materials such as alumina and other elements of it. I wouldn't get on details, but it makes the heat transferred in a very faster way within the circuit. And that means is you could actually allow more components. So for example, in such a circuit, you could have more than 500 components on it, because you can put the components on both sides of the layers, but you could have not only one layer, you could have 7 to 8 to 10 layers. That one, for example, what you see is about 10 layers and has about more than 500 components on it. So you could see how fascinating this innovation is. And that will allow us actually to go more further and allow us to talk about artificial intelligence and quantum computing. Next slide, please. So the other components of all of this innovation is artificial intelligence. The more data we collect, the more we actually try to create pattern, and the more we would like to create machine learning. So currently, when you ask me, where are we in the artificial intelligence, I will tell you, we are in the level of having a brain of a child. The more data you put in, the more this brain can grow. One example for that, for example, robotics in the surgery. There are lots of procedures can be done now through robotics, 100%. Not complex one, but definitely not, very straightforward ones. And the more the robotic does these procedures, the more data we can get from others, the more advanced and the more knowledge they have, and the more independent they become. So that means is there's a huge potential there for having more precisions through the artificial learning. And if I may say so, if we compare, for example, just for your understanding, if I compare where the data flow, for example, we were using 2017 until now is tripled. And that will be even more and more in the future. So you can imagine why machine learning and artificial intelligence is important. But that is only one element. So we talked about 5G, the network. We talked about the circuit boards, which is more powerful. We talked about artificial intelligence to cluster data. And the last component in all of this puzzle is quantum physics. Next slide, please. And I was really intrigued on my former presenter. Of course, Einstein puzzled a lot about quantum physics. And of course, majority of us probably don't understand what this has to do with the healthcare. is set up originally to try and understand the quantum world, where a particle can be found in two different locations at the same time. So if I may say, the quantum computing in comparison to normal computer, where normal computer works with zeros and ones, bits, the quantum computing could work with both, but also could work in a totally different variance of communication, which it didn't exist yet. That will take us to a totally different level of innovation. And that will allow us actually to talk about a powerful computing which we didn't have before. And that is also a step further in more precisions in whatever we're doing in treatments, but also wherever we do in the healthcare side of things. I don't know about the time, but I will make it fast, but I will only mention one example, which is really fascinating. This is about finding defects in our neurological brain. And that means is more specifically when treating such a disorder like Parkinson or Alzheimer, epilepsy, you need to localize the affected brain regions as exactly as they are. And up to now, this has only been possible with superconductive magnetometers, which have to be cooled to minus 269 degrees, and with the liquid helium. The scanners that use them are correspondingly complex, huge yet cramped with patients, extremely expensive, and rarely found in hospitals, actually. So the quantum sensors, what we are developing now from Bosch, can be in the contracts, in a room temperature, require no cooling, and is so small that you can put it in a helmet. Of course, now what we have in the laboratories of Bosch is bigger than a helmet, but the future will look to have it in a circuit board size or even in a chip in a cost minimal than and less than €2. So you can see how innovation is going in which speed. And of course, and I agree with Matthias, we shouldn't forget the community on the heart of it. But at the same time, we should unleash whatever innovation can help us to have better life. And Bosch, as we all say, we develop, invented for life to make our life easier. And thank you very much.
Thank you very much, Emma. And goodness me, there's an awful lot to take in there about the new technologies. Let's take a couple of questions for yourself before then bringing Matthias back to pick up on some of the issues. Eva?
Yes, we have Oscar Blanco who has a question.
Yes, hello, let me start my video perhaps. There we go, hopefully that looks okay. Hi Malcolm, good to see you again. So my question was, earlier in the presentation you mentioned that one of the challenges or one of the considerations for the new innovations, particularly from Bosch's perspective, is addressing this idea of having the widespread public accept some of these new technologies, particularly when there's a lot of fear or misinformation or uncertainty about it. What are some of the ways that Bosch is implementing their outreach? How are they trying to spread this kind of information, or maybe try to convince the public that it's not as scary as some of these conspiracy theories might seem?
We're really working through, I mean, today is a big example for that, you know, to find alliances with other people to create communities and work together. We work with lots of local authorities. We think, and my experience, to be honest, in the telehealth at this time is that I feel that some of people feel that businesses are evil. And, you know, I always think that it's better to communicate that through the community itself. So through, for example, nurses, doctors, through also social workers, and educate them about that. So for example, I do lots of voluntary lectures in universities as well as in communities. So, you know, I would love to be invited wherever to explain it, but also we invite people in-house. So we do open days where actually community can come in, can have a look to that, and can engage with us. And for example, the technology is what we develop. We also precisely before we get into, if you like, the commercial stage, we bring it to a certain community to take a survey about if that is the acceptance of the usability of the product. We learned our lessons. You know, it doesn't make sense to bring a product to the market and you know for a fact people will not use it. So therefore, there are ways, lots of ways of marketing and PR. But as I said, we found the best way is really to go through community.
Got it. Thank you so much.
Eva, do you want to pick up another question as well, briefly?
Of course.
I didn't. Oh yes, there is one which came in right now, so I didn't have the. Well, I am inviting you, Andrew, if you want to pose it aloud.
Sorry, just unmuting. Hello, Malcolm, and everyone. I'm just interested in the evolution, Imam, that you're describing, and I was just inviting you to comment on, we're looking to meet from where I sit, we're looking at a sort of technology convergence, and I'm old enough to say we sort of saw something a bit like this in the 90s maybe, where, infotainment came together with the IT industry and the internet was launching. Here we have medical device companies, we have consumer electronics, we have, electronic patient record system providers, etc. So my invitation to you is to look a bit into the future and comment on the value chains. And in particular, I work with small, innovative SMEs, which are typically looking to enter the market, and it looks pretty tough from their point of view in terms of valleys of death, effective engagement with larger players. Could you comment on that?
First of all, I'm very happy actually to look at it offline. If you get in touch, I appreciate these challenges, and we have from Bosch side of things venture capital arm, and our role is not to overtake the companies. Our role is to mentor the companies. Because we know for a fact it's really hard, and you have to have a long breath and a big budget behind you to allow you actually to access the market. That's what I meant with the cross-functional collaboration, because as Bosch as well, as we are a big giant, but we don't do things all alone, and it doesn't make sense. So it means is that there are lots of elements of the value chains needs to be done from SMEs and startups. They're actually the backbone of the economy. And therefore, I'm more than happy to have a look at it. Please get in touch. And as I said, if I can help with putting you in touch with our venture capital or other divisions which can bring synergies, more than welcome to do so.
So if I can have a quick follow-up comment. I coach lots of smaller European businesses, and these businesses get funding from the European Innovation Council, which funds accelerator grants and things like that. Well, I've been doing this for about 5 years, but a kind of common theme is from the SMEs is who should we be getting in touch with? How should we do it? I'm just wondering, and I've also worked for large multinationals in my past, but I'm just wondering about how we can improve the level of communication, especially and engagement between the larger companies who in many sectors kind of dominate their particular fields, with these European type initiatives which are seeking to bring SME-led innovation to market. I don't yet see many of the larger multinationals effectively engaged with things like the EIC. Maybe there isn't the structure to do that, but would that be desirable from your point of view?
Yeah, well, we know, we are aware about actually the challenge, and I don't know if you're aware about Bosch initiatives with the Startups Harbor. It's an initiative initiated in Berlin about actually this topic, what you are mentioning. How could startups, if you like, it's like a CV application. You apply for certain projects within the organization to integrate them within the organization, give them the learning of how actually they can sell themselves. I have to tell you, I had myself, I sat on lots of startups communities to promote them, and I must say 60% of them, they were technically fantastic, but the way how the business case was set up was badly done. So that has actually closed the door to the corporate. And secondly is they didn't know how to sell themselves. So I agree with you. Lots of mentoring has to happen, but the key is the business case, because that was my opinion, my experience for the last 3 years. 80% failed, not because the technology wasn't there, because they couldn't sell the use case. But let's talk offline. I appreciate that Malcolm is now getting nervous, but we can talk offline.
Well, I do want to start that discussion between you, Iman, and Matthijs as well. And perhaps if Matthijs comes back online, that would be great. I'm aware.
Sorry, but in the meanwhile, I have one more person who wants to say something, which is Loretta McInnes. She will be very short.
Okay, come on, Loretta.
Right, okay, can everyone hear me?
Yes.
Okay, so, I mean, it's really a question for all three. Hi, Iman, a long time no see. Malcolm, and also, hi, and also Matthias, really. There's lots of discussion here about organisations and organisations working together, which is obviously well and good. The issue is that unless you get individuals buying into this technology, it doesn't matter what you do and how fantastic it is, it's not gonna work. And the only reason that digital health has taken off so dramatically is because people saw a need for it because of the pandemic recently. So I sit with a patient's hat on now, having worked in telehealth for many, many years and spent many, many years being very frustrated by the journey because we were not getting through to anybody. What can be done to engage the individual? Because that is the only thing that is going to make the difference here, is getting people to want it and to realise that actually they need it. They're going to take ownership of their own health journey. Very much what you were talking about, Matthias. I love the idea of the work that you're doing there. Getting people to take that ownership and getting them to want to adopt this technology because actually it's going to benefit them.
Right, I think that's probably a very, very good starting point for the debate between Iman and Matthijs. I noticed there's another question here as well, which I wouldn't want us to lose, from Malcolm Clark, about innovation, trying something different and this kind of stuff, but that actually relates to this in a way. Yeah, so maybe we can give Matthijs the first word here about whether or not what Loretta's saying makes sense. And actually is another kind of follow-up to that, because Iman made some very positive statements about not leaving people behind and making sure that people are connected. So are Bosch actually the good guys here? And are there some more bad guys out there that we need to give attention to? But first of all, I mean, is what Loretta's saying, does what Loretta says there make sense to you, Matthijs?
Yeah, absolutely. So, in my introduction, I told you only part of what I do, but I chased to Europe to talk about digital transformation. And from my point of view, digital transformation has never been about technology, but also always about social innovation. And that for me is the same as all the technical aspects. The reason why you want to use something and how to come to that, that's of course the holy grail for big organizations. I do want to, how do you say, pay my respect to Bosch, because I press enter now. This is SEMPEC. I don't know even if Iman knows this, but there is a Robert Bosch Stiftung. Of course, she knows that. And the Robert Bosch Stiftung contributed to the SEMPEC organization. And SEMPEC is a center for empowering peoples and communities throughout Europe. It's a starting organization which is seeking out all kinds of nice initiatives in how to empower communities. So this is also about how I stand in my work in Utrecht as a strategic partner for the municipality. So there is no them and us. There is no big organizations versus small people. The challenges we face in our world are too big to drive each other apart. So we have to do this together. So, but I do think there are lessons to be learned. So I'm really agreeing on what you say, Loretta. You have to incorporate people with all those different hats on. So just to make sure, if the Health Pact Utrecht sounded like organizations working together, it's about initiatives working together. And lots of initiatives are grounded in societies or organizations or official businesses, but also lots of in more informal organizations. So we have all kinds of volunteers. We've got a huge amount of people in the network that are just like me, living in a street I'm looking out on my street right now. We started a WhatsApp group, in which we asked people who needed help in COVID times with their food, with their groceries, with their health, and almost every street in Utrecht has a WhatsApp group to support each other. And in one of our a little bit more, how do you say this, neighborhoods which needs more attention because of all kinds of reasons, there was a huge WhatsApp group with 200 people and organizations that took on every problem that encountered in COVID times. So 8 people that were illegal but didn't have a place to sleep got a place to sleep. 152 elderly people got a warm meal every single night because of that group coming together. And if you then say that the social structures and behavior and individuals are one thing and technology is another thing, even as simple as WhatsApp made it possible to connect a whole neighborhood. So I think that maybe to conclude, I think that we want too much too fast. And I think social innovation is also about time. And it's about, people ask me sometimes, how do you manage to be enthusiastic about what you do? I say, I only need one thing, that's time. I need more time, because this is real, making connections with individual people within the community, be part of that group, join with professionals. Professionals are connected to their organizations. There are all kinds of demands, all kinds of needs. Those aren't aligned yet. But we, in Utrecht, we try to do that with health and all policies, that every single time the focus is health, the healthy urban living for every individual Utrechter. And that's a unique way of having a common language about what we try to do. So that saves you about half an hour in explaining that we try for the same goals. So a little bit a long answer, but it's really intertwined, and that makes it complex. That's the reason why Einstein was in the picture. You don't have to explain it every single time. Sometimes you can just fall back on the simple rules and just start doing stuff. And that starts one by one by one by one. So the community is nothing without its individuals.
Okay, right. I'm going to actually step back a little bit, and because I actually want a bit of a dialogue between Matthijs and Iman actually on these kind of topics. So maybe Iman could pitch in with something around what Bosch does to actually get really sensitized, if you like, to those community issues. And I don't know, and how could you help each other more in Utrecht and as an exemplar? You know, it could be any city in Europe.
Yeah, I'd like first of all to point something else as well. So first of all, Bosch is a charitable foundation, absolutely. 92% of our revenue goes in social projects. We have our own hospital actually in Germany as well, where we try to get more understanding about certain innovation type of development there as well. I want to point out to Loretta question first of all, because it is not one way person to blame. When I was in the telehealth side of things, and I come from the automotive sector, I felt that it depends what you're talking about. So for example, telehealth device, if it has more medical advancement in it, in the way how we measure things, then it's becoming a medical device and cannot be sold as to the consumers. That means it has actually to be approved from a health profession. And we need to understand that actually the GPs are business people. So if you are talking about telehealth system, which is actually can take their patients away from them, that wouldn't be accepted. So that was a part of the problem, fear of losing contact to the patients. On the other hand, we were selling it as, you know, getting the frequent flyers away from secondary care and empowering social care, which we know that actually they're suffering from capacity. However, it didn't come from the business that we didn't want to give you the devices, and because we're not looking to the consumer individual to engage. No, because the more the medical device is complex, the more then we have to have a medical approval, which it will take us to 3-4 years to do so. So what I'm trying to say, Loretta, is there are lots of challenging around it. Now, for example, the consumer products you see in the telehealth, they are actually made in a way that you will agree not having sufficient measurements, and you will accept the fact that there are some average movement within the measurements you are taking and you can buy it as an individual. So it's really, that's what Matthias is saying. It has to be a community of professions from the healthcare, businesses, big guys, and also the people who are on the ground working, as well as the individuals, to express the needs for these technologies to come forward. So we all have to work together.
Yeah, I agree. I totally agree with what you're saying, but I think in the past, I think the individual has been missed out. And I'm only saying that based on some of my own personal experience of being in the industry. But I think things have moved. And I think COVID has been a huge step change for that. So yeah, I think it's really moving in totally the right direction. And I think prevention rather than treating care, as you were saying earlier as well, is really key. So absolutely.
Yeah, is video communication a medical device when it's used for consultations with GPs and others? I think the answer is no. There's got to be an issue here, hasn't there, about the length of time for medical approvals where necessary for some kinds of devices. I don't know. Anyway, go on. Matthias, do you want to respond to Ayman? Or do you wanted to say something more, Ayman, first, didn't you? You were responding more to Loretta then.
No, you know, overall, you know, really, we are coming here with open arms, and as I said, we have to work together at the end of the day. And you know, we could develop whatever we want to develop in a closed room. It doesn't help us, because if you are not happy with it, it will not scale up. So that means is we need to have more feedback from the community. What we found now after COVID, actually, it's interesting development that individuals coming up with ideas to Bosch or others and sharing it in actually developing the products what we have in the marketplace. So it's a lots of dynamic is changing now. And I think moving forward that you will probably not find any more this communication big guys talking to medical professions only, but really considering also the need from the individuals. So we are definitely changing the way how we are operating. And we do think that the COVID will change the way how things actually are happening.
Okay, and on to the other point there about the way that Bosch connect with the ordinary folk in the street in Utrecht or anywhere else, and how you and Matthias might be the kind of people who would need to work together to make something really happen.
We have lots of European projects from Horizon 2020, but also we, as I said, we have the Startups Harbor in Berlin. We're trying actually to do one in the UK. Startup Harbors is more or less is actually creating an open door to startups and SMEs to come in a project Bosch working on it, but we're having a challenge. So for example, let's say in the quantum computing you heard before, it's an open area where we need lots of brains to come together. And so we open a challenge and we let the others to actually apply for it. That is one area how we are engaging with the community. But, you know, we're also engaging with like cancer communities, etc., because we understand more about patient challenges and we hear more about it and try actually then to develop and change the trends. This is only ways of what we are doing it. But I'm really also encouraged to hear from Matthias how he sees things should progress.
Yeah, so this is the T, one of the T's in CT3. That's trust. It's trust in that the individual knows best versus that a company could always assist or be built on ideas made by individuals. So I think that Iman and myself don't have to use huge amounts of times to connect, because we are telling the same story from a different perspective, I guess. What I find intriguing is that the whole perspective on how to deal with wicked problems needs to shift. So if you look at the municipality of Utrecht, where data scientists are running specific demographics from a street, for example, in that street, a particular street in Utrecht, there's a huge problem in the neighborhood. People are littering and people are annoying each other and people are not very nice. Before you know it, the data scientist explains that there are different ethnic groups, that the net income for the average family is this and this. There are so many unemployed. This is the education standard. So I think that's great. We have so much information on those people. So then we know exactly who they are. But what's the helping factor in all that knowledge? If you know that those 30 people live in those streets have to live there together and share much more in common than they are different from each other, because they all breathe air, they all need water, they all need food, they all need love and attention, they all need access to social engagement, to believe in that next day could be better. And so my perspective is that in everything we know and we could derive from data and knowledge and technology, that we have to go back to what's the question in that individual or in that local community, and then address those input. Because I generally think that technology is already surpassed humanity, and we are trying to get in control again and understand everything. And so we as humanity are the biggest barrier to gain the next step in technology. And that's I think if we let it go a little bit more and not try to control or harness it, and a little bit more based on trust, then I think great things can happen. And then technology and social innovation is one thing.
Iman?
We are on the same page. We're talking the same language. I think nothing really to comment except to say, absolutely the same page.
Okay. Perhaps, Ava, we could leave her in a question or two.
Well, we don't have exactly questions, but we have many people making comments in the same direction, which is related with e-health and telemedicine and the need to have also live interactions. So any of those many people made comments on that sense. Maybe Gary would like to stress this idea.
Thank you. Yeah, I just really appreciate the conversation. And then, as I mentioned in the chat box, Matthias, I agree with you. The most average human is capable of bringing down the most sophisticated technology. Human beings will always be the limiting factor, how we adopt it. One of the questions that I would have, I think goes more to Iman, is that based on this fact that the humans will be the limiting factor, how cautious really and prudent do we need to be at this point not to oversell the capacity? So you're talking about quantum computing and neurosciences. I'm a neuroscientist and I've been studying the human brain for 30 years. And I can tell you the technology is nowhere near where it needs to be to do some of the things that people are hyping it up to be. Not that we won't get there. I believe we will, absolutely believe we will. But when, I'm not too sure. We can measure stuff, we can quantify things, but can we actually put it into a systems biological perspective that then goes out into a community perspective? Those are very different levels of conversation that need to be had. So I'm excited about all this and I believe it. I'm just also very cautious when it goes to selling what the potential is right now versus what the potential is later on.
I agree. I don't agree, but I see your point. So that's why I talk you through lots of elements has to come together to actually allow us to do that. You're absolutely right. We're not there yet. But first of all, you need to have the network. So 5G is not rolled out yet in everywhere. So 5G needs to be rolled out. 5G is very important because it will allow the latency to be almost zero. Because let's be honest, Gary, if you are having, for example, an application done in the computer and you're waiting more than 2 minutes, you will say, oh my God, I can't be bothered. So the low latency is really important, that you feel it as a real-time communication. That's the first one. So you're absolutely right. The 5G rollout probably will take another 2 years probably to do it. And this is, I'm talking about development countries. Developed countries or first world countries, let's say, not developed, first world countries. Then when you have the connectivity, then you will start to collect data. Collect data means is, and I'll bring it maybe, let's leave healthcare, and let's bring it to another example, to automated driving. So automated driving means is you drive on the motorway and you have a technology which is actually will allow to identify, for example, that there's a car in front of you, there's a car behind you, it's communicating to a third infrastructure in the motorway, and you're driving. Now, when we talk about automated driving, we then say that the driver doesn't interact anymore. That means is the computer of the artificial intelligence, the machine in the car need to have intelligent of a human or even more. because we cannot put the human under any circumstances of danger. So I start to collect data. So for example, data about what? Data that you have in the car, in the street, you could have a child walking. What would happen when I have a child walking? Which size of this child? How big is this child? What color of this child? Then you will have, for example, a bag is in the car, in the road. What kind of bag? How big is the bag? This all information will create a brain of a child. And then afterwards, you start actually to advance this child. And this child becoming even more intelligent than human, because it can actually calculate in a fast speed that we cannot do it in our normal eyes. When we reach to that level then we need to have a quantum computing, or a computer which is powerful than the computer what we have now, because you started to calculate in an immense way. Means is now we are talking about computing and binary interaction, 0, 1. When we talk about quantum computing, you're talking about a third layers, which you don't see. And that means is we're starting to talk about telepathy, communication, and a way of that you don't have to speak to your computer, but you could actually, you can through your thoughts, you could control things. And that is beyond that. So that means is actually that I start not only to recognize that you have a malfunction in some of the brain regions, but I also can develop these brain regions in an artificial way to actually then create synergies between you and the machine learning. But this is something, it's not happening now, Gary. I mean, I said we are in the research phase. We need another probably 10 years to go there, but we're starting now and there will be some applications coming up. And it's for you really to give you a taste of where we are now. But of course, it will take time, but we're heading there. And of course, when I say that to the community, it's scary, because people, they don't want to lose control. And they're thinking, you will put a chip in my brain and you know, I don't have control of my thoughts. Of course, because the way where you have technology, you have to have ethics. And that's why where the community comes in. If you have technology, the technology can be angel, the technology can be evil at the same time. So you need to have framework, you need to have government policies to control it, and you need to have also community to accept that.
Okay, Iman, we're going to have to close it very shortly now for a quick coffee break. But I'm going to just pick up on two messages there. I mean, that last point you made there about ethics, obviously very important, and almost a hint there that the community, the people, could be the ethical kind of watchdogs for the conduct of the companies that are developing the technologies. AI, I'm sure, will be discussed later on in this webinar, so we'll come back to that with all the opportunities and the excitement and the risks. And Matthijs, who's signaling he wants a word, is going to say something about trust as well, I suspect. But before I just hand over to Matthijs very, very quickly, just to say that Matthijs actually hinted at something as well, which perhaps won't get much of a mention today. And that's about kind of deprivation and the social determinants of health, the fact that there are some troubled areas in Utrecht and what have you, and behavioral issues and so forth. And the fact that we may have this divide involving perhaps some poorer people who have greater health threats, whose nutrition is poor and things like this. And just something for us to remember at the back of our minds, that it's all very well as having great devices that can help people's health, maintain their health, but actually there are some social determinants that we may not be addressing. Matthijs, quickly.
Yeah, so this is roughly about what I was about to say. So it was just, there's a phrase or saying that said, when lost, any map will do. And I think that in public health and in health in general, we are quite lost. And what's the next step, and how to? We see the data growing and rising. More and more people with diabetes, with COPD, with all kinds of heart disease. And so it's a wicked problem. So we are a little bit lost in the next step. And I think when lost, any map will do. Technology was part of that map. So there is a high belief in the capacities, and that's what Gary said, of course. And I don't think that's not true. I think that there is an enormous amount of anticipation of technology. Only if you now have technology innovation in a petri dish, the general public already says, we want to have it, we want to see it, we want to use it, but it's immature yet. Like what Iman said, there is so much more to gain. And I think it's an interaction between society and technology and industry that sometimes they allowed it to go out into the wild, and it didn't live up to expectations yet. So sometimes I think hold your horses, and we have to find ways to make that language more common. And then so there is a big problem. So we need escapes. So any escape.
Okay, right.
Have a good coffee break.
On that note, we'll go for a coffee break for 10 minutes. We'll reconvene at past. Eman, Matthijs, thank you very, very much. Don't go away. I'm sure we may bring you in later on in the
coffee.
Thank you so much. We'll be back again, I'd say, in 10 minutes' time. And Lydia Montandon will be chairing the next session. Thank you.
pleasure to introduce you to this session about the developing picture in public health. And we will start with Erke Boyten from the Montfort University. He will introduce good business and the safeguarding of people's health data. And especially now that vaccine passports are becoming a reality, we need to face, probably it's a very good starting point. So please, Erke, the floor is yours.
All right.
Yes.
I am here. So yes, thank you for the introduction, Lydia. Vaccine passports. I don't know whether you follow the UK media. They are indeed big. The vaccine passports have appeared on the National Health Service app, and there has been a fair amount of confusion about it. But it is very clear that vaccine passports have been introduced also with the purpose of enabling events and other things, not just international travel. So there are some worries about that. I have just published something about that yesterday, which I will stick on the chat later. So yes, that's kept me quite busy the last few days. I accidentally sent a tweet about it, which now has been interacted with about 300,000 times. So yeah, people are worried. I think that shows, and there's lots of paranoid nutcases responding to worries I express about privacy and equality issues that associate with the data. Okay, so I've got 10 minutes to talk about good business and the safeguarding of people's health data, which is a challenge, but also is a welcome opportunity to focus on a couple of little things that hopefully are a little bit new and a little bit provocative. So my background is I'm a computer scientist, working as a cyber security person these days with a privacy a good privacy interest, particularly in health data associated with it. And I'm also the head of school at the Montfort University. So I welcome every opportunity to escape from the administrative mess into talking about real stuff like I have now. Okay, can we move on? Okay. Oh, I had my points flying in before I realized that I wouldn't be in control myself, but that's okay. So my first line would be we shouldn't really share health data. Right, sharing health data is the biggest source of all sorts of problems. Health data paint a rich picture of an individual life, and you can't once you've shared it, it's gone. So can you bring in the next point, please? So that's the first reason why you shouldn't share health data is once you've shared it, you don't know where it's gone. You don't know people may say sticky policies or they may say funny things, but realistically, you've given it away, and it can be copied arbitrarily. It can be passed on. You can't know anything about it. You can't control it, right? And privacy is about control. Or privacy is about confidentiality and control at the very least, and probably a few more things. And all those things tell you, it's not a good idea to share data. Next one. So this thing doesn't exist, right? I could talk to you for a bit longer about why this doesn't exist. Somebody told me today that all opticians have a database of all the eye scans that have ever been done in the country, and that's health data that you can sort of anonymize, because if all you really have is that scan of an eye, then it will be very hard to associate that back to a person. But the majority of health data, where you're looking to detect trends, see how things influence health, how things go over time, or just even the richness of normal GP data with hospital data is just too rich, gives too much information that you would stand a good chance of keeping it anonymous, having it anonymous, keeping it anonymous. It's redundancy within the data. It is possibility of linking with other data, linking with outside knowledge. So anonymized rich health data really doesn't exist. So let's not fool ourselves saying, well, we're okay sharing as long as it's anonymized. This is a bit of a problem. Next point, please. So is there an alternative? Yes and no. There are clean alternatives for the largest style of research where you lock people up in a room with the data and you only let them out with sanitized results, and you don't allow them to carry pens and papers into the booth where they interrogate the data. That's how census data is treated in the UK, for example. But so that's a little bit limited. But there are some better ways. I think the critical thing to keep in mind about sharing data is sharing is an implementation mechanism. Sharing is supposed to achieve something. Sharing is supposed to is a preliminary step to realizing the potential of the data. So instead of sharing the data itself, you might think of sharing the access to the data through APIs, through interfaces where you control how the access happens, where you perform some privacy checks, maybe using differential privacy, which is one technique that allows you to keep an eye on how bad any privacy impact might be. And generally there are privacy enhancing techniques for doing computations over data that you don't have, in a way that you don't even have to know the data, but just extract the information from it that you need to. But some of that stuff is doable. Some of that technology, but people like me and people who are a lot smarter than me working in crypto and privacy enhancing technologies need to work a little bit harder to come up with the realistic alternatives to do that sort of use of collaborative use of health data without risking its privacy at scale. So that was my first point, not to share health data at all. Next point, please. The other thing that I would suggest is that we should worry about what we do, and not just worry in a sort of chaotic way, but we should worry systematically in a number of ways. So next point, please. So the one obvious way of worrying is to align yourself with ethical frameworks which help you to ask the questions about how you go about your business dealing with data. I always mention this one because I miraculously ended up being involved in setting up the Nuffield bioethics guidelines for dealing with health data. Report's still available, freely downloadable. I think it's quite interesting, even if the political developments that are discussed in it are a little bit a few years behind technologically and ethically. It doesn't outdate as quickly. Next point, please. Okay, my background is cybersecurity. So I would say let's also worry about keeping the data secure. I don't think third parties, people who overlook who try to invade our communications, who have nothing to do with it, who we don't know, are necessarily the biggest danger. Well, I am sure that they're not really, but yeah, we might systematically apply sensible cybersecurity measures, access control, monitoring of access, encryption of communications, things like that. Okay, and the final one is probably the big one. Next point, please. And I am always going on about data protection impact assessments, right? The GDPR requires those in any sort of serious processing of special category data, which health data is. And I think it's a good idea whenever you do that to think systematically about about what could go wrong. And think about your risks, think about the mitigations, think about how the data processing impacts on human rights and freedoms. That's the deeper thought behind the GDPR expression of DPIA. And it is just so important. It's just so important to systematically ask yourself, what could possibly go wrong, right? So, and that is as far as I'm concerned, that is the central question for data protection impact assessment. I mean, yes, proportionality and necessity and all that sort of stuff, and absolutely very important too. Should we be even doing this? Are there other ways that don't involve data allow us to do the same thing? Yes, absolutely important questions. But in terms of the deeper worrying, if this is going to happen, if this is something that we're considering, let's at least look through all the possible risks, including, of course, the risk of function creep. Right. So to tying it back to the start of what I was saying about vaccination passports. Part of what I'm saying in the press today is the UK has introduced a vaccination passport without publishing a data protection impact assessment in advance, and without even any knowledge that anybody has done one. And I think that's such a terrible mistake to make, particularly because a database of people's vaccinations and certificates that people could use in context to be allowed to do things where things is undefined has so much potential for function creep. You really should be thinking about that. Okay, I think that's my 10 minutes up.
Thank you very much, and thank you for being on time. Eva, do we have questions from the audience?
Yes, we have a comment by Ryan last. Ryan?
Thanks very much. Yes, well, it's a comment that is going to turn into a question, actually, because it was so interesting to hear, don't share health data. And we tend to think of health data as what is held perhaps by our general practitioner or perhaps by a hospital about us, but there's so much more. We're sharing health data in so many ways and through so many avenues all the time, sometimes knowingly and sometimes unknowingly. So I'll give you some examples. The wearables that we have, you know, tracking our fitness or lack of it or whatever, all the time, that information's being shared with us, but who else is having access to that information? And do we actually really think about that? And even, you know, supermarket shopping. What sort of food are we buying? How much alcohol are we buying? Are we buying cigarettes? All of those things are giving away an awful lot of information about our lifestyles and our health. And not everybody perhaps is as thoughtful about that as maybe they need to be. So I just wondered, I'd like to hear your comments on that, please.
I fully agree. Another infamous example of inadvertently sharing health data in the UK is when we these days, when we don't know something, we do inverted commas research, right? And that's what the anti-vaxxers throw at us. They Google stuff, and people who are ill, have symptoms, are worried. Google their disease and go on websites, and they might have ended up on the National Health Service's information pages. In their early incarnation, this is about 10 years ago by now, they had Facebook tracking buttons on them. So this was a design to a naive design, maybe, based on the idea that making these NHS pages have a social network dimension to it would make them more attractive. But of course, it led to Facebook knowing what diseases and symptoms people were worried about, which wasn't quite right. And I think similar sort of stuff is still going on, just not as blatantly, but yeah, Google still knows what all our searches are. It will still detect patterns in order to take those into auto-completion suggestions. So yes, there is good examples of health or health related data from Rwanda, and there is more, but it's at varying degrees of intensity and sensitivity, I guess.
Thank you.
Thank you. I don't know if there is another very quick question that we can take before the next.
Oscar Blanco has a short question.
Okay.
Yes, thank you. Let's see if I can get my camera on here for a short moment. It's working. With regards to a lot of the talking points, a lot of these kind of stay in this sort of, I hesitate to call it a higher level, but something where people that are very much involved in this space, either academically, professionally, scientifically, however you would like to define that, these are conversations that do regularly happen in these spaces. However, when it comes to the sort of day-to-day life of consumers and people that can engage with technology or just health data, whether they are accessing the healthcare system through appointments, or if they are using something like a fitness tracker or whatever apps are running on a smartphone, there's really a lack of, not necessarily transparency, but these are not conversations that come up. Are there any recommendations that you would make in terms of being able to bring these sorts of topics or ideas to the forefront of a consumer or an average person in their daily life to start considering these sorts of things?
I think that's a really interesting question. It touches, if I understand it correctly, it touches on issues related to what people call the privacy paradox. That people are, if you prod them gently, they will be paranoid about privacy things in a very general sense, but then in their personal lives they will do things which with a little thought should be considered very thoughtless.
Right, ourselves in this webinar included as well.
Well, we're all on Zoom, right?
Yes.
Is that that might be right? That might be wrong. No, just teasing there. But I think when I get drawn into discussion about things like privacy paradox, I get a sense that we're also being presented by the world by a slightly distorted narrative, which involves things like that if you the main concern that you would have with social media privacy would be to make sure that your settings are all set in the right way, right? And I think the bigger story is privacy as a collective good rather than as an individual good, which means that you need to look at things like privacy by design. So rather than putting people in a situation where they can do something bad, in inverted commas possibly, you make sure that these situations are less likely to occur in the first place. I think the responsibility for the control of adverse privacy impacts is too often laid with individuals, when actually it is far more structural than that. Now, your question was more about the awareness of it, but I think I think to some extent my answer is we need to lift the level of awareness to the global picture rather than to the micro picture.
Right. So rather than, this specific use case, then it's stepping back and on a structural level, the entire landscape of interacting with digital technologies as a whole should have this structural shift to prevent some of these issues from happening, if I understood you right.
But there may be a sort of awareness story that goes along with that.
Right. And
I think this is a very inspiring question, in the sense of it challenges me to think of what is the narrative that would take the public discussion also to that level, rather than looking at the individualistic And
Right.
it's either a million miles away in Silicon Valley, or it is close to home where you can get everything wrong by typing the wrong thing in the wrong app. And then there must be sort of a better picture of overall awareness there.
Right. So there should be an opportunity for individuals to be able to interact, although in a structural change, as you've recommended, there can be a space for a committee or some kind of representative or whoever from different groups. Potentially, I don't know what this would actually look like, but participation would still be available, but it doesn't have to be every individual participating, and rather you can have a more collective participation. Something like that. I mean, that's at least what's going through my mind when I'm trying to envision this kind of structural shift. But I'm currently living in Germany, where there is many layers of interaction and bureaucratic levels to any kind of group and privacy, as you can certainly imagine. So this is something that I encounter very regularly. But thank you very much.
Thank you.
Thank you. I think we will have more time. We have more questions, but we will have more time after our second speaker of this session will be able to present, and we will come back to those questions. So please, I would like to invite Ignacy Lopez Verdeguer to let us know how funders can have a role in promoting responsibility in health innovation. Please, Ignacy, you have the floor.
Well, thank you very much. Thank you very much, Lydia and Malcolm Fisk and Eva Swazwan, the whole organization of the Living Project, for inviting me. It will be a pleasure to give you this introduction. And this is a presentation of quite a different perspective. So more from a global health and governance perspective. So I hope that is interesting to the audience, and I will start right now. So, well, it is. Can you? So, are you changing the slides? Yeah. Can you put the next one, please? Well, first of all, a couple of very, very brief words about La Caixa Foundation. It is a more than 100 years organization, initially a social savings bank in Spain, based in Barcelona. Now it's an endowed foundation, like many others that you might know. The Robert Bosch Stiftung was mentioned before, but the Wellcome Trust in the UK, or Volkswagen Stiftung, the Cariplo in Italy, so many others. Now those assets are put in several portfolios, banking portfolio, industry, and so on and so forth. But of course, we are interested in the other part, which is what we do with the money that comes out of these revenues. So basically, it's around 500 million euros a year that we spend in social programs, in culture and science, education, and research and health. And this is where I'm going to focus on. I wanted to show this structure because, well, first of all, there are a couple of things that I would like to talk about. One, not to talk, but just to mention. First is that we consider health and research in health a social investment and a responsible investment in itself. Of course, to maximize its responsibility, we do several things that we will speak about, but just first point, for us, health is already a social investment. And second, the role of philanthropy here, and maybe we can talk about it later, the role of philanthropy in health research and innovation. If we talk only about infectious diseases, pandemics during the century, we could talk about the role of the Rockefeller Foundation with yellow fever, or the Bill and Melinda Gates with malaria, and now recently with COVID, we can talk about the role of the Wellcome Trust of all the Bill and Melinda Gates as well. So there is a growing space, in my opinion, on the capacity and the interaction of philanthropy with public authorities, and we are seeing that in these pandemics. Next slide, please. But what I'm going to focus in is what we do in research and innovation. And basically, this is the ecosystem of what we do. We have, and I will be very fast, but this is important for I will explain later, research open calls, several in collaboration with other entities, we spend around, I didn't say that, but we spend around 100 million euros a year in science in general, in this aspect, basically focused in biomedicine, so 70 million euros around. So we have research open calls and innovation and acceleration programs for early stage technology transfer projects. And here is where I will try to focus in a minute. Finally, we give strategic support to basically 4 research centers in the area of Barcelona in infectious diseases, oncology, and Alzheimer and neurodegenerative diseases. So before I start to say what we do in relation to responsibility in health innovation, I wanted to start with a reflection, and this comes with the next slide. Next one, please. Yes. So this is a slide that I saw and I asked permission to show to Dr. Peter Piot. He is director of the London School of Hygiene and Tropical Medicine, probably one of the most global health research institute, one of the best in the world. And that was in 2016 at the European Research Foundation's conferences at the Wellcome Trust in London. So those were the recommendations of a post-Ebola panels after the Ebola outbreaks that were in 2014 and 15. So first of all, you can see there are several recommendations on governance, on public health, global governance, the strengthening of epidemic preparedness, need for reform of the WHO. There is a recommendation on engagement with communities, NGOs, a recommendation of sharing data and samples, and about the market incentives. What happened? So the question was, when I saw the title of this conference, it was about public health and responsible innovation in a post-COVID Europe. But okay, it's not only post-COVID, but what happened with the pandemics that we suffered, not the whole world as this one, but we suffered recently. And why didn't things change enough from 2014 to now, so we could be more prepared for the pandemics that we are living in? I don't have the answer, of course. If I had it, I wouldn't be here. But I will try to see a couple of things that we have done right and we haven't done right. So one of them is the first one, the one that I have circled here. We certainly have been better in sharing data and samples. So maybe we can see that in the next slide. So it is we have been seeing that, and this is an article that was published in Science, a completely new culture of doing research. Coronavirus outbreak changes how scientists communicate. So we can see here in this graph that from the beginning of the outbreak, preprints were being published, and there was an intensification of the communication that catalyzed an unusual level of collaboration among scientists. And we can say that combined with the scientific advances has enabled researchers to move very fast at the beginning of the outbreak, and has luckily brought to the market and to society vaccines that are paving the way out. But at the same time, we are seeing that those vaccines are not reaching everybody at the same speed. There is issues of trust in several countries. So there is a question if in the States, in the US, there's going to be the possibility of reaching herd immunity due to the lack of trust in vaccines. So science has moved well, but the relationship between science and society, so the responsibility of science towards society hasn't moved that well, probably. And why that? And here comes the end of the reflection. And let's go to the next one. Yes. Well, because this is a very complex issue. There is a bunch of number of scholars. They call themselves post-normal scientists, that they say that facts are uncertain. When we have issues where facts are uncertain, values in dispute, stakes are high, and decisions are urgent, we have very difficult decisions to take, and things are difficult to cope with. One of the one of the frameworks for responsibility that we know is the one that gave us responsible research and innovation, and that the project Living is trying to define specifically for industry and for business. And this is the one that we are following at La Caixa Foundation. And what I will do now is just show you 2 or 3 things that we are doing, taking into account this conceptual framework. So, but basically my conclusion will be here that responsibility in the relationship between science and society and in public health in a post-COVID Europe is a full-time job. And even if you try to do as best as possible, things are, take time, and institutional change take time, and many efforts have to be done, and we have to learn a lot yet. So a couple of examples in the next slides. Next, please. First of all, what do we do in relation to the ecosystem of, it is almost 2,000 researchers that we are working with. First of all is to have a vision of research management towards clinical and social impact. We don't do basic science is great, and we fund basic science, but we always fund research, and we try to accelerate projects so they become spin-offs, and but always thinking about the clinical and social impact. So this is the first thing. We try to manage the full spectrum of research and innovation through the knowledge of a conceptual framework for research management that goes towards impact. Next slide. This conceptual framework is the one that we were seeing in the previous slide, but as well the one that gives us, and please click again so we can see the whole thing, the one that gives us responsible research and innovation. So that tries, as you know, to involve society in science and innovation very upstream, in the process of research and innovation to align the outcomes with the values of society, and a kind of research that is diverse and inclusive, anticipative and reflective, responsive and adaptive, and open and transparent. What I'm trying to say is that with this framework in mind, strategic decisions are easier to take if you really want to try to comply with all the values behind the conceptual framework. But still, it's always difficult. There are many things that you can do little by little, by small improvements, but of course, being it's difficult. It's easy that you have more too much to chew in the plate, because applying responsibility to every action that you do is hard. But as I was saying, it's a full-time job. So let's go to the next one. So one of the things that we do, for example, these are in our acceleration programs for spin-offs in the biomedical and biotechnology area. First of all, we try to we start from the assessment of the projects. Here you have the assessment criteria. So of course we have the market potential of the asset and the valorization of the project, the implementation capacity, but as well we assess the social impact and responsible innovation of the project. So when they start in our program, from the assessment of the open call, they see that if they want to take good grades, good scores, they have to implement a fully responsible innovation process, take different voices into account, and usually less heard voices, and so on and so forth. When they start in the program, sometimes they still don't know what we are talking about here, and they don't have the 7 or 8. But then we have a training program with expert advice and a mentoring program that we try to bring them closer to this reality, even though they are entering a program which is an accelerating program that is going to try to bring their asset to the market. So we have the 2 forces, the market pull, but the responsibility push, let's say, that we try to implement. So yeah, and next slide. One other thing that we do, and I am finishing, is trying. We do open access and open data. We said that this is probably one of the only things that have progressed a lot since the Ebola outbreak in 2014. So, and we are trying to be quite sophisticated here. It is not only that we have a policy behind that, but we try, this is a recommendation from the last report of the European Commission of Open Science. And one of the recommendations for funders was try to ask your grantees to do output management plans, which is quite complicated. But what we have here, as in the previous example, is a training package that we help our researchers and innovators to do these output management plans, taking into account the responsibility issues of data stewardship and others that were discussed in the previous talk. Let's go to the last slide, and this is an example of governance. This is, we heavily fund the IS Global, the Barcelona Institute for Global Health. In fact, I'm a proud member of the Board of Trustees of the center. It's a 400 research center. It is the second best global health think tank in Europe, by the ranking of the University of Pennsylvania, and it has, what we try to do here is that they have a strong policy advice department, and they do things like recommendations to yesterday. This is from exactly yesterday. A publication in the Lancet making a proposal for a better preparation for future health emergencies. So those were just only 3 examples about what we do in the assessment of acceleration and technology transfer projects in open access and open data and in health policy governance. But as I was saying, for us, the most important thing is to have a framework that can help you in taking the strategic decisions, so the programs can be well oriented toward the best responsibility performance. And that would be it. Thank you very much.
Thank you very much, Ignacy. Eva, let's start if there are questions related to this presentation.
Yes, until now I have 2. I will start with Oscar Blanco.
Hello, thank you again. So my question is, La Caixa is based out of Spain, so I assume that there were probably some investments within the country. And I'm not sure if maybe this is not something that has a general answer, might be outside of the scope of the time that we have today. And if it is, let me know. But Spain's healthcare system, which is arguably one of the best in the world by many metrics, operates as a central system of individual autonomous communities. And so when you mention this idea of focusing on the social aspect of health for whatever is being financed, inevitably there will be some kind of output that needs to be balanced on a political level, and not to bring politics into the discussion, but for the purposes of, trying to, in this example, provide social benefits and social welfare to an entire country that is based off of a federation. And there are many other examples of this similar governance in other countries around the world. Is there something that needs to be taken into consideration, or something that influences the investments, or if an investment is being made, something to guide the output to ensure that this is not limited to, let's say, one autonomous community and not the rest of the country?
Well, basically, I would say that we are not playing a big player in the kind of innovations that, or the stages of the innovations that you are talking about. In fact, like Caixa Foundation, we invest very much in early stage, in basic and preclinical and clinical trials. and then in very early stage projects. So I believe that you're talking more about public procurement for health. So we are not so much into that, so we don't have that problem. But the sensitivity, of course, among the 17 autonomous communities in Spain is something that you have to take very much into account if you work in the country at any level, and we do so. But in fact, we are based more in research and innovation excellence. So basically, we have open calls for the whole country. So any research center or hospital for any part of the country can apply independently of their public health regulations. So it doesn't, for being so long, but it doesn't affect us so much.
Okay, great. Thank you so much.
And well, we had also this reflection by Gary, who very much liked Ignacio's approach to think more holistically, but he will, I hope he will join us and explain himself.
Oh, absolutely. I just want to say that I appreciate the taking of a step back to go, we're able to measure lots of things now with new technologies. We're able to communicate on scales that are unprecedented in the past. And I love the graphic of how the scientific community with this pandemic started collaborating. And again, that's a very good thing. It's also open to debate how well we are controlling the information, how well we're understanding it, how well we're, bringing back in the level of rigor and quality of the information. And so we're basically drowning in information now without increasing our wisdom or our knowledge as much. And so just to simply take a step back and say, what's your strategy? What is your exit policy? What are the knock-ons that may happen with what you are doing? And so if we can't answer those things right up front, we may be creating extra problems whilst we're trying to solve something else. And so I just want to say that I really do appreciate your reflections, because they are so needed right now.
Well, thank you very much. We have been, well, just me tell you just briefly, we have been participating in responsible research and innovation projects from FP7 and Horizon 2020. So this has helped us very much in embedding into the strategy these kind of things. But it's always, as you can imagine, there is always tension between that and the need of producing results. For example, our innovation program, we carry it together with the a venture capital firm. So they basically, what they want is just to bring solutions to the market and make money, so that the tensions that is created between us and them is very fruitful, but sometimes difficult. And you were saying something about the increase of the infodemic with and you're totally right. So the unprecedented amount of knowledge that has been created has been outstanding in providing with vaccines and treatments and so on, but as well there has been not so robust science that has gone through the editorial processes of journals, which has produced not desired effects. So I concede as well that there is a tension between rigor and speed in what we are producing, but I would say that benefits of this rapid information sharing outweigh the disadvantages, and this would be the conclusion. So, but thank you for your comment.
Okay, thank you. So maybe let me try to open the debate a little bit and try to connect the presentation from Erke and Ignacio, and maybe be a bit provocative and taking it to the extreme. We have a policy of sharing with Ignacio, and maybe it's sharing a more aggregated or compendium of data, while the not sharing your health data from Erke. Of course, you have been talking also about education or training, and maybe we have touched a little bit about this earlier. Should people be educated before they share their data? And maybe another question is, how could we then compensate those people who are sharing so that this sharing is happening and still there is no bad effect of sharing? So who wishes to start?
Well, let me say that thank you for it's an interesting, and I would like to hear what Boyden has to say. But let me say that it's I don't see a conflict between what I say and what was said before. I totally agree that we have to be very careful on how we share data. Absolutely. So especially medical data as well, we have to find ways of sharing, of being able to use aggregated data to understand better the fundamentals of disease and the best way to treat the disease. But it is a very complicated issue, and of course I cannot say more than Boyden is an expert in that, and I would love to hear what he says. But just as a first reaction, I don't see and of course, when we talk about open science and open data, we always talk about the best, the open as possible, but as close as necessary. And there is a conflict always here, a conflict which is difficult to determine when one thing starts and the other ends.
Thank you. Okay.
Yeah, I'm not really sure what I should add to that. You've not set us up very well to land in a disagreement at this particular point.
No problem. What we try to do is to converge, maybe. So that's not a problem.
Well, let me add that after Erke's presentation, there has been a parallel chat here of many people reacting to his provocation. So many people were commenting on the advantages of sharing data, health data. So maybe somebody wants, of the many of you who wrote in that sense, maybe somebody wants to join the conversation on that.
Yeah, because in the end, I think it was highlighted that there are many benefits of sharing as well. But so then, if there are benefits, how can we compensate, and what is the price of the data that you are sharing? But maybe we can leave this to an open question at at this point. If time is over for this debate, I don't know, Malcolm, you can tell us.
I think we could spend a few more minutes on this. I mean, I would like to tease out that issue around data. And there's a point that was touched on earlier, or perhaps not touched on, and which I wanted it to be touched on, and that is with regard to artificial intelligence and the fact that what comes out of the analysis of data very much depends on the quality of the data that goes in. And so there may be all kinds of biases that are built into what we do with our data if we don't get the right data. And if there are restrictions, if you like, or if there's some issues around the extent to which people are willing to share, that clearly impacts on the quality of the data set.
Yes.
I was actually asked by a journalist this week a question about the value of health data. Now, if I tell you that it was an Irish journalist, do you know what the context was? The Irish Health Service has a massive ransomware attack where all their data is being held to ransom, and they're insisting that they won't pay. So the question is how much is it going to cost? And I think Malcolm makes a very interesting point about AI there. One thing I raised, which didn't end up in a news article because it's probably a little bit too esoteric, is that when you look at the health data of an entire national health service, which then one of your customers for selling that data potentially would be anybody who needs a massive amount of high quality training data for their AI, and it would have the additional advantage buying that data that nobody would know that you've got it, right? You just trained your neural networks with them, and your neural networks are very precise as a consequence. But assuming there are no extreme sort of attacks against the patterns in there, which some people can do, but then yeah, highly valuable in that sense. But actually, if I can say one more thing about the value of data and compensating, I think treating data as a possession is a dangerous road to go down in the first place, right? Because you cannot trade away your properties. They will be your data about you will always be data about you. So and I believe that some of the rights to your data are inalienable, if you want to use that sort of language. You can't give away. You can't sell human rights.
What about informing better then?
Or informing better is always good, right? And of course, when my slide said don't share data, the emphasis was different, right? The emphasis was don't share data. Share access to data by all means, but not the data itself.
Lydia, and I see Matthijs has got his hand up.
Yes. So we should close here, or?
Well, I say Matthijs just wanted to contribute, Lydia.
Yes, please.
Yeah, so I was just wondering, so if lots of these discussions, and I don't think it doesn't really, the theme of a discussion not always is of influence, but it's like it's a sort of a black and white thinking. That's a Dutch expression. I hope the English is similar. But it's like it's on or off. It's like when I did presentation about transformation, I made a sort of a metaphor that people are opening up the window in the morning and they pull up the closure, and then they look outside and say, okay, great, AI still isn't here. So and then they go on with their work. So I think Lydia, you said something about that sharing and communicating about what we are discussing. I think everybody here in these kinds of discussions sees the fear or the risk, but also the challenges and the great benefits we could have. But I think that in the general public, it's like black and white. It's like we are already sharing so many data. So people in the Netherlands voted against an international or a national health record. And on the other hand, on Instagram and Facebook, they make selfies. This is my 3rd chemo. I'm feeling well. Please thumb up to support me. So there is already so much sharing of data on one hand, versus that people still. I wonder, do people see or feel the risk, or is that something that professionals feel, or experts like Eerke or Ignacy, Lydia?
Okay, thank you for this contribution. I think that we need to stop now because we have a very short break until the next session, which will start at 4:30 Central European Time. Is that okay? So we convene again. Thank you for staying with us, and thank you for participating.
Thank you.
See you soon.
All right, welcome back, everybody. I hope you managed to grab a coffee or a tea in that short break. We now have a quickfire session with 3 speakers. I will briefly introduce them now, and then obviously we'll move quickly from one to the other. First of all, we have Miriam Martin, as you can see from the slide there, from TIC Biomed. I saw a video of her when she was speaking last year, just a few days ago, where she was talking about TIC Biomed bridging the gap, and I guess we'll be hearing a bit more of that. But one of the things she said was, companies often don't understand the markets. Sometimes they don't listen. It's easier for them to say, this is my technology, without taking or giving sufficient time for feedback from potential users and so forth. And I wonder if that's a message she'll be giving to us today. She's followed up by Matthias Marzinko from DragoWork, which is a company that makes non-invasive patient monitoring technologies. A long track record, by the way. They've been around over 100 years, I think. And he was active in the US German standards panel for medical devices, harmonized standards and things like that, very much in his field of vision, and a very international perspective, so we can escape a little bit from our European focus. And then finally, last but not least, we have Beatrice Solano of Resilisense, who's going to give us a CSR, corporate social responsibility perspective, and where her LinkedIn profile talks about business development, circularity, and that word I mentioned at the outset, sustainability. So I'm looking forward to hearing all of them speak, and obviously to facilitating a debate at the end of this session, which should round off the webinar, I think, very, very well. Now then, I think we have got some of the speakers there are actually sharing their own screens. But oh, here we go. We have Miriam first of all.
Okay.
Yeah, Miriam, are you sharing your screen, or are we?
I can share my screen, yeah, if you want, yeah.
I think that's right, actually, that you are, and I think the same is true for Matthias and Beatrice.
Yeah, no problem. Yeah, ready?
Okay, here goes.
So can you see my screen now? Yes?
Yes.
Perfect. Okay, so thank you very much, Malcolm, for the organization of this event, and to all the other speakers. I think that the session so far has been pretty interesting. So as Malcolm introduced myself, I work for TIC Biomed. This is a cluster organization based in Southeast Spain. And what I'm going to present in this session, it is basically our experience working with healthcare organizations and also with companies and patients in the, let's say, somehow trying to advance in the digital transformation of the healthcare. And more specifically, we have had a couple of experiences on co-creation and need identification. So let's see if I'm able to move. So what we have learned, it is that there's a lot of technology available in the healthcare market. There's a lot of technology, and it's seamlessly accessible from anywhere. But the problem is that sometimes that technology doesn't meet or doesn't match the needs in the market. This is, I mean, doesn't meet the needs of the patients, doesn't meet the needs of the healthcare professionals. So one step that needs to be considered, but seriously, it is that need identification, to see where is the market, where are the needs. So we have just identified like a couple of steps that needs to be taken in order to advance into the co-creation, advance into the digital transformation, and let's say moving the healthcare organizations into the innovation culture. So the first one could be securing the innovation culture within the healthcare organizations, doing things in a different way towards the use of the digital technologies. Also, it is important to have a bottom-up approach. I mean, starting from the professionals, from the patients, from those that have the real need. Following it is important to have this bottom-up, but it is important also to pay attention to what the healthcare management has in mind, the priorities, what the regional priorities are, the national priorities are. Following, I mean, once we have identified this, we could really set up a demand-driven co-creation, working with the companies to make easier for them to understand which are the real needs. And then this will make it also easier for the regional level and the national level to spend the funding and the funds in a more efficient way. Because I mean, the funds will be used towards a clear need existing in the organizations. And within all this framework, we have realized that ecosystems are really important stepstones. It was commented before that how important, I mean, in Spain, we have these 17 regions and we are quite autonomous in the implementation of the healthcare. But at the end of the day, you really need to understand which are the stakeholders of the ecosystems, who are the members of the ecosystems. And this is also important when designing some activities that are aligned with the responsible research of innovation. So, although it is the last issue, it is not the less important one. So as the first point, securing the innovation culture, I mean, organizations have been implementing the processes in one way until now. And especially now with the pandemic, they have realized that they could really do things in a different way. It's not that they could do things, but they needed to do things in a different way. So summing up, I mean, you need to introduce these processes with bottom-up need identification, not only with the professionals, but also with the patients and with the society or with patients association, including also technological centers, universities, I mean, those that are really close to the technology. Then the management of the organizations need to have a clear prioritization of the need. And once they identify which are the important needs to be funded, because of cost efficiency, because the number of patients, I mean, a lot of many different reasons, those needs have to be selected or prioritized and say, we are going to focus here. And then you will be able to start a co-creation process with the companies. In this case, what is really important is to have clear KPIs to define which, I mean, how successful the initiative has been. And it would be great if all those co-creation processes would end up in adoption. This is through procurement, PCP, PPI, any way of procurement. But adoption at the end of the day, it is the end of the process. So, as I said, important to have a bottom-up approach. I mean, we need to involve the professionals and the society. They have a say, and it is important to identify which are the where is the talent within the ecosystems. I mean, sometimes we have in all the ecosystems really innovative people that is able to provide really good inputs and really good ideas on what we could really focus, and also, by doing so, this bottom-up approach, you are able to motivate not only here, I only mentioned the professionals, but not only the professionals, but also the patients, because they really feel that they have a say, that they can do something to improve either the treatment or the service that they are providing. Which are the challenges that healthcare organizations, or for healthcare organizations and for patients, it is not that easy to identify how to do this need identification process. So that is a new thing that has to be introduced in the organizations, has to be explained to the patients. Also, by doing so, that means that you are giving the professionals additional tasks, additional work, because I mean, at least in many of the healthcare organizations, their task is to provide services to the patients, healthcare services, but not to be involved with companies. So that is an additional work that you are giving them. But also one important thing, it's like you have to transfer the need to the suppliers. And quite often you need to, let's say, translate that. You get the need from the patients, you get the need from the professionals, but you need to translate that into a language that a supplier, a company, is able to understand. And you need to do that. Otherwise, and this has taken us a lot of time just to complete the whole process. So following, as I said, it is not only bottom up, it has to be also top down. So the priorities need to be really clearly identified, and you need to understand and you need to involve the IT departments in the implementation process, because there's a lot of technical aspects like interoperability that need to be taken into consideration. So creating the right communication channels with the professionals, with the patients, with the technical departments, it is really a must if you want to succeed into co-creation. So as I said, once we did all these processes, we have started demand-driven innovation. And this is really to work with the companies in an organized way. For the companies, especially for the SMEs, it is a great experience. They understand better how to work with the healthcare organization. So they understand better that it is not only technology push, but it's also based on the needs of the organization. And as I mentioned before, the ultimate goal is really the adoption. It's not only to start co-creating within the healthcare framework, but it's also to manage the final adoption or the final procurement of those solutions. As I said, we really believe that by doing things this way, the use of funding will be more efficient, because there is really a market, there is a need. So you will really invest on those solutions that you have co-created and have a really clear, successful KPIs. And finally, last but not the least, ecosystems. That is one of the most important. If we want to involve patients, if we want to involve universities, if we want to involve technological centers, healthcare organizations, social care services, you need to understand which is your ecosystem. And it's not evidently in place. You really need to look for the different roles. Which is the role that each of those organizations play in your ecosystem. And they are, I'm not going to say different, but they are organized in a different way in different countries and different regions. So you need to, let's say, tailor any methodology towards the need identification and towards the co-creation by understanding the roles of the different stakeholders within the region. And also it is important to network not only within the region, but also at a national and European level, because it is amazing lessons learned that you can get by mixing experiences in, for example, Nordic countries and Mediterranean countries. The approach is different. There's a lot of learnings to be applied. So I know I went over the 10 minutes, Malcolm, but summing up, we need to change the processes within the healthcare sector. We need to do things in a different way. And it is not only about data, it is about understanding why we are using that data. And I think patients and organizations understand why it is important to use the data. That will be much easier. But the beginning, it is really to understand which are the needs and set up those processes in the healthcare organizations. So thank you very much, Malcolm.
Yeah, no, that's brilliant, Miriam. Thanks very much. And we have got time for a couple of questions here. And I just want to make an observation, first of all. You said about translating information using the right language or something like that.
Yeah, yeah.
What you're saying is that we may all speak English or we may all speak Spanish, but actually there's other issues around language that are even, well, as important, if you like, so that we both understand, or we all understand how we are thinking, how the commercial perspective and the community perspective may come from different directions. And communicating or getting the communication is not necessarily easy between people who come from those different backgrounds. Is that right?
Yeah. Yeah, that's right. I mean, when patients define the needs, they define the needs from their own experience. When the professionals define the needs, they define them from their own experience. But if you have to launch a call for companies and you have to let them know the companies which are the needs, you need to put them a little bit more in a business language. Not only from the experience point of view, but also include some other maybe technological and framework aspect within the organization. So that was something that we had to pay a lot of attention to, and we didn't realize that we needed to do that.
And this is an essential part of the ecosystems that you're talking about.
Yes, yes.
Did you get some good ideas from Utrecht? Do you think that that sort of activity is part of your idea of an ecosystem?
Yes, yes. I mean, it's like, as I said, all ecosystems work in a different way. They have different stakeholders. So we have really learned a lot from different experiences, and it is a way to improve and to implement like these processes in a better way.
Okay, and can I just throw one more thing in your direction, and then I don't know even if there's some more questions. But you talked a lot about SMEs.
Yes.
And I wonder how different you see the SMEs are from the big companies like Bosch, who spoke earlier, of course. And are there some different criteria that need to apply? Can you bring them both into your ecosystems?
Well, I mean, I think in the experience we had, because the calls were like in a really, let's say, low budget, like big companies didn't, and it was mainly addressed to SMEs. I think SMEs are really creative, but when it comes to like large PCPs or large solutions, they really need to partner with big companies. But at the end of the day, even big companies find in the SMEs like quite a clustering activities or cluster knowledge that could really benefit them into like innovate or providing a different approach. So we have mainly worked this way with SMEs, apart from PCPs that we have worked with large companies. But it's still, I think it's a really good combination between SMEs and large companies.
Okay, well, that's a positive message. Ava, I think we better move on to the next one, but if there are more questions, we'll store those for the debate at the end there. So I'd like us to move over now, please, to Matthias Marzinko, please, who'll give us a standards and possibly a more international perspective. And I think, Matthias, you're going to share your screen as well.
Yes, I will scan.
Thank you very much.
Share my screen. Identify the right one. So you should see it already.
Yes, that's good.
So
it's not obviously the full presentation, you know.
You see the presentation mode?
You see it, not in presentation mode, it's in the other mode, you know. Start from the beginning.
Give me a second.
That's it.
Yes, okay, perfect. So it's not standardized every time, and every system I use it's different. And I'm a standard passionist, so you identified me for various international and national standard activities. And I want to use the time to put a short 10-minute spotlight on standardization and the role in it. So, and maybe bridging the gap between small companies, big companies, and the society. And I want to start with a question to all of you who are listening. You see the ladder under the solid rock here. So if I give you 10 euros, would you lay your head under this brick? And what would be expected? That people start to argue, no, I wouldn't make it for 10 euro. I would make it for 15 or give me 17. Is this also your opinion if we are going into this discussion? I think this is a market-driven discussion. And in reality, you will ask other questions. One of the questions are you sure that the stone is fixed adequately? Are you sure that I can trust you? What is the reason behind that stone? So it's not only the amount of money you are spending in your lifetime, it's a matter of trust and whom you trust. And this is a perfect starting point for responsibility and trust. And in the pure economic sense, you have a customer and you have an industry or scientific provider for services. And the industry wants to provide the best services to the customer, and the customer has a choice to take the best product or the best service that fits to him. But to really be sure whom to trust or whom to spend all this responsibility to. However, if you are not directly the customer, so if you are this premature baby here in the incubator, or if you are even a doctor in a hospital, you do not have the direct choice whom to trust. And if you trust with all of your life, so if your head is crushed when the brick stone is falling down, you do not have even the choice to say yes or to say no or to spend for the cheapest one. So for all these reasons and for all these industries and sectors, you have certain other players in the field. And this is typically the lawmakers and the regulators who have two parts of responsibility they take over. On the one hand, they have to ensure that all the population in their area, in the European community or wherever, they are safe, they are secure, they can live in a good region. On the other hand, they need to control the manufacturers and the science community to really give this trust and come along with their responsibility. And this triangle of trust you can see in different ways. So if you go to the Americas, if you go to Asia, if you go to Europe, you have certain level of powers around this. And whatever is in the background, we are all living on the same planet. And in the background, there's a fourth factor. So we have to do the sustainable development for the future, because it's not only a one-to-one relationship, it's a relationship for the region we are living in, or for our planet we are living on. So these are four factors, and these have to be combined in a way. So it's either here this marketing issue, or it's a regulation, it's a regulating issue. But if we bring all these four parties together, we come to the standardization idea. So bring all together on a table, give them all the rights to speak up and to align in a consensus form to a good paper. So what we want to think, it's safe, it's secure, it's trustable. So this is the matter of building trust all together and giving everybody a voice. And I need to emphasize, and I printed it in bold, to work together in consensus. This means that everybody is fine with the result out of that. And it's very different what we sometimes see from regulations. It's not a compromise. A compromise is if I give you clause 6, can you give me clause 7? And you negotiate the result of an law. Consensus is the way that at the end of the process, you have a result where everybody can live with. And this is a different thing, and this is the guarantee for a trust in a new system, which is individual, which is global, and which is cross-border driven. So independent from culture, independent from political environment, independent from the manufacturers. If you come along with a consensus paper, which is called standard, you have a certain level of additional trust on it. And if you see this responsibility, what is guided by standards? So the way we are writing standards in Europe or around the world has to follow certain consensus principle. The first one is openness. So everybody is able to participate in standards writing. It's not limited to lawmakers, it's not limited to industry, it's not limited to the customers. So it's everybody on the table or represented on the table. So if you are not participating as a patient, certain patient safety movement, foundations, other representatives will be there and represent your needs so that you can balance all the interests of the participating parties. And at the end of the day, you reach the real consensus. And not to get out of this balance, to be unbalanced, you need two additional pillars to focus on if you're writing standards. The first is a due process. That means that you know in advance how the process is working, how transparent is the process, how objective is the process, not to be surprised by some popping up standards, by some standards coming from nowhere. It's very transparent and very due process. And if you are not satisfied with that, the last pillar comes into force. It's the appeals process. So it's the obligation of all standards writers to discuss each and every comment which is coming into the standards, where the interested stakeholders have the right to stop the process by voting and to really take care that consent is granted before a standard is published. The backside of the medal is that it takes some time, but I think this time is very good invested to really have a document which works around the world. And by saying working around the world, I think this is a guarantee for innovation and a guarantee for the society that you are with standardization not really in a national setting. You are typically in a European setting or in an international setting, or for healthcare in a global setting. So by writing ISO IEC standards and adapting them around the world, you are overarching 99% of the population. So this is independent if it is Arabic, if it is African, if it is ASEAN, or wherever you are thinking about. It's an overarching approach, and the standard is valid globally. So think about data running around the world. Data knows no borders. Data knows no different settings around the world. So this is a key for innovation and for smaller companies and bigger companies to really get a scale up in a global scale, in a European scale. So a very important part out of that is that you are in compliance with the principles and that you intend to go global with the standards. Last but not least, what should be the result out of that? And what is on the agenda of the standardization committees? And from the very past, it mainly starts with safety. So which cable to touch without getting an electrical shock. But today it's even more. So it's a security, it's a privacy coming in. And in the last years, more and more the sustainable goals. So what are the sustainable development goals, how to interact with that? And at the moment, ISO IEC, but also SEN and SENELEC is linking all the standardization activities to the United Nations Sustainable Development Goals, and really have to list the goals they are supporting. And I estimate that in the near future, also priorities are set by these SDGs. Last but not least, if you are starting to innovate, this was in the past a matter of patents. So you protect all your intellectual property. If you go to 5G, if you go to sub-sensors, if you go to global networks, innovation cannot go and cannot run by patents. It more and more is run by standardization. By starting up standardization activities, by bringing these technologies in a broad stakeholder's hands, and really guaranteeing that innovation is being published in a common sense and into a global setting. And coming back to that, it deals back with all the stakeholders we saw in these three angles, in these four parts. It's independent if you are a small company, being in your individual country, for example, in Germany, if you go to the Dean, it's just a travel or a call to Berlin, or if you are in Sweden to take contact through the SIS. So you can be there from a small company, but also for large corporate companies, innovation and sustainable development will work on a global level for all our supply chains, for all our work out of that. And this is a thesis I told to you. And what is the proof for that? So does this really work for companies? And I'm not only chair in the advisory board for healthcare standard in Senelec. Of course, most of my time I'm working for a company. And I brought with me an example how these stakeholders and how these responsibility is working in a real company. So in our sustainability report of last year, we put in a power interest matrix and identified all persons and all stakeholders having interest in a sustainable development and in our sustainable approach of the Draeger company. And you see here in the blue, surrounded area, that standardization is in the quarter of high influence. So standards are not taking care what we as a Draeger company are doing, but has a very high influence on what we are doing. Similar to lawmakers, similar to medicals. And if you see on the right-hand side, with a high influence and a high interest, which are our customers, which are the medical customers, our safety customers, but also our investors, they have a high interest in these compliance with standards, compliance with laws, and compliance with our sustainability interests. And that's very interesting to see. If we go to sustainable responsibility, that the standards we apply also directly contribute on the shares we are selling. And it was very interesting for me to see how many people which are spending their money and are one of our most important and most influential stakeholders are looking on corporate social responsibility. So in 2019, 7% of the shares were held of sustainable investors, and it grew up to 24% of the shares. So very remarkable and very much of a motivation for us as Draeger to really apply standards, to apply with the laws, and to really invest in sustainability for the future. Another directly linked from our sustainability report is innovation. So for a standard, we started to develop from scratch, was an ISO IEEE 11073 standard, which allows an manufacturer independent exchange of data between medical devices. And we did not start with a patent. We start with a freeware software. We started with standardization activities to really be sure that medical devices around the world and independent from the manufacturer can communicate to each other and make the pledge to free data between medical device manufacturers. So this is also a sustainability goal to be there. I saw already a sign from Malcolm, and also, and just a small focus on that, even loans we try to combine with sustainability goals and to see what's going on there. And it's not only driven by standard and it's driven by money, it's driven by the family company, and Stefan Draeger, who is the CEO of Draeger, has a good wording for that. As a family entrepreneur, the things I do today, I want to explain to my children tomorrow. And standards we set, I think this is a guarantee for innovation for tomorrow and that we can explain why we did certain things and why we did not certain things. And as you do not share the slides itself, I just copied the literature for deeper reading here in the video. So maybe you can get a deep dive if you are interested in the economic things out of that, in the social corporate things out of that, or what medical devices makes it very special for standardization. Yes, these are my some minutes out of that.
Thank you very much, Matthias. You did run a bit over time, so we will hold questions that you would be well equipped to answer until the debate and discussion in a minute. And of course, people can revisit on YouTube the whole of this this webinar, so they'll be able to pick up on some of the references you've given there. But I would like to just pass straight over then to our last speaker before we get into that final debate, and that's Beatrice Alano. Who again also I think is going to share her own slides, or am I wrong there?
Yeah, Barbara is going to share my slides. I asked her, please.
Okay, Beatrice. Anyway, you're very, very welcome.
Thank you.
And being the last speaker, you're certainly not the least.
I will try to be quick because I know we're over the time. Thank you, everyone. Well, I wanted to talk to you about, my topic was measuring responsibility and why healthy and sustainable business makes sense. So I'm sure you've talked, I mean, I haven't been able to be in the whole journey today, but yes, at the end, and I'm sure you talked about this a bit, but anyways, we all know that becoming a sustainable business is very beneficiary. I mean, some of you have mentioned it. It might take a bit of time and big investments on value chain engineering and on business strategy redefinition, for instance. The businesses are starting to take the lead. Society became more demanding on ESG topics, and governments need to take it more seriously to work on support this transformation. Sustainable strategies can contribute to mediating factors that drive financial results. You probably know all of this, but I would like to make it 5 cents, like sparking innovation in design, in process, products and services, like operational efficiency, so cutting costs by reducing waste and the use of natural resources. It helps a brand stand out from the crowd and increase market share and sales, rising customer loyalty, risk management, to improve employee relations and attract talent, fostering supplier relations and improve stakeholder engagement. I think, Barbara, you could have passed, yeah, anyways. So I will go directly. The ESG reporting has been rising over time. Companies' place in society has changed, shifting from the old idea of Milton Friedman, who is being named so much in conversations lately, that the unique role of the company was to make profit and that everything else was about following government requirements and following the law, to companies having to be aligned with society's expectations around inequality, diversity, racial injustice, gender parity, waste management, etc. So we could say that today's corporate leaders, responsible corporate leaders, must care about the 3 Ps: people, planet, and profit. I read a report from the Yale University, and they say that these companies that put the social agenda into their business strategy, they exceed systematically the competition. So businesses have came into a tipping point of no return. As you mentioned, only digitalized and sustainable businesses will succeed. This is a very clear statement. And therefore, companies are getting on the train of measuring, rating, and scoring their sustainability performance with the help of digitalized solutions and artificial intelligence. Despite of some tragic setbacks, as some of you might heard, like the firing of the CEO of Danone, Mr. Emmanuel Faber, for being too sustainable, I would say that this movement is not to be stopped. Yet we are only at the beginning of this movement, of this transition into a sustainable economy, and the tools need improvement as well as the standards need to be global. The standards have been created to guide businesses through this journey, as Matthias was pointing out. But I think that a lack of global standardization is inhibiting a faster rollout. But still is important, and we should be positive that we came so far, because even though the situation demands, as we know, a much faster evolution. Companies should consult these standards, they learn from them and use them to improve their practices. Here we have the GRI, the ISO 26000 that is on sustainability, SASB, the Sustainable Development Goals. All of these are good to have. But the next step is to measure business responsibility to identify real impact on companies. There is a very famous and old quote that helps making sense. And it says that whenever you cannot manage what you don't measure. And this is from Drucker, as you see. So going back to the reporting, we find in the market lots of different sustainability reporting tools, measuring impact on ESG. Using measuring tools is a very good way to approach sustainability, but these must be used consciously and honestly for its own business. We measure to improve and to track the progress. Today, we find some problems on the report, unfortunately. Companies report what's easy to report and what makes them look good. But the real progress comes from focusing where they are not so good. The companies, they need to be more robust on their reporting and take more seriously the strategy of the business, aligning it to the society's new values. So comparing various time periods, it's interesting to know which companies are raising and which companies are raising fast, and also to know which are falling off. So it's important that we put the data into context, because isolated data makes no sense. So a correct approach on reporting is key for investors and for the community. Another point to take into account is what kind of measurement solutions we use and what do we want them for. Here, the focus should move from rankers and raters to materiality. And I explain myself. In the current business environment, it is imperative for a company to become more sustainable. Companies that do not manage ESG risk effectively and become more sustainable, they're facing an increase in risks, such as non-access to capital, little talent, and less business opportunities. The businesses should not play with predefined solutions based on industry and size. It's not enough to measure and to obtain a score. It's also important to show the improvement, the real improvement. It's a matter of transparency and individuality. And here's where I come. The materiality assessment, it should be the starting point. So engaging with the stakeholders, which at the end is who they know the company the best, who they know all the activity from this company the best, and together identify what is relevant and what is significant. Then you define priorities. There are risks focused on rating and scoring. These ratings focus on disclosure and not so much on performance. And risk mitigation is performance. These companies check the box, but there's not a tailored approach to risk management. They only focus on the requirements to get a good rating and to disclose it. But this is not the goal. Yes, they get recognition, but they do not tackle what is relevant and significant to the company. So this is exactly one of our main priorities. Resilience takes great care on giving the users the right tools to engage with the stakeholders. It offers a 360 view from internal and external stakeholders. It goes deeper in the analysis. It makes the results more accurate, offering full visibility on the calculation scores, making the areas of improvement clearly identifiable to the user. This tool, as many others, it's a dynamic and digital solution where the individuality of each company is accounted for. So it's also based on the ISO 26000. And as I said, and like all these tools should be, we continuously work to improve and adapt the solutions to our clients' needs, because these tools are alive. So when sustainability is integrated into the business strategy, it becomes more action than disclosure, because it puts into action those ideas on how to mitigate risk and position the company into a sustainable environment. Materiality is the important issue to approach, understanding what matters and what's going to make a difference. Thank you. I hope it was clear, the materiality issue, Malcolm. Did I answer to your question?
I had a little correspondence with Beatrice before, well, the other night, and obviously I was looking for some clarifications. Now, that's another matter. Let's go to some questions. We've got, say we've got 10 more minutes in order to re-engage Matthias and Miriam. Ava, have we some questions, please?
Yes, well, there was an interesting exchange between Francisca and Miriam, which maybe they would like to share with all of us regarding living labs and the way of working and so on.
Yeah, well, I mean, Francisca was asking that like they work with a professional, really innovative and full of energy, but it was not that easy to work with them or to co-create the solution within the hospital, because it was, again, additional work. It's like the way that the work of the professional, it is defined in the healthcare organizations, it is usually like providing healthcare services. So that co-creating part with companies or developing or being involved in the development of solutions, it is not that common. So she was asking me if I had any hints. And my suggestion was that to first address to those organizations that already has an innovation unit or a lab. There's a lot of healthcare organizations that are now moving into including innovation as one of the units, and they have different procedures to allow professionals to work into the development of solutions. And even I think, well, now with Horizon Europe, but in Horizon 2020, there's quite a few organizations involved into the implementation of some projects, research projects, and that involve like working together. So let's say that that could be a sort of pilot into the change of the procedures within like working with companies and changing the mindset of in healthcare.
Can I just mention very briefly as well, because Miriam mentioned Horizon or European Union programs. I mean, with regard to Horizon Europe and the last year or so, I've noticed an increase in the emphasis being given to standards, actually, and that there's an expectation that projects put forward will actually increase the reference to standards and the way they will use them to actually make progress towards their innovations. Now, Matthias, I did want to throw a question at you, but I'm sorry, I've cut across Francisca actually, because she probably wanted to respond to what you were saying, Miriam, but we'll come back to Francisca. But Matthias, you know, because I emailed you on this, that I've got a bit of a frustration with the world of standards, in the sense that we've got these now digital tools, we've got the internet, we've got email and all sorts, and we've got Zoom, who knows, all sorts of things. And yet I don't see the balance of interests being expanded to include a wider range of stakeholders in the standardization processes. Am I wrong?
Standards have a different time stamp on their work. What I was also talking about, that we are now working or are now living in a very volatile world. And that's not only the best for innovation, and that's definitely not the best for healthcare services, just changing from one day to the other. And therefore standards gives a kind of stability in an uncertain and an ambitious world. And therefore, sometimes it seems to be like snake speed in standardization. On the other hand, standardization can be very fast if it comes to 5G, if it comes to modern parts. And I can give you the examples for the European Innovation Center that came up with new ideas for organs on chips. And one of the first ideas was, oh, we have to come into contact with the European standardization bodies and tell them about what we are planning, what the future will be in combining human organs with some chips and with some nanotechnologies. And it was very clear that there's no way around standardization. And I think this will be the key for the future. And it seems quite slow, but enormous speed is going on, taking pace with artificial intelligence in healthcare, with some very new scientific approaches. And I think the anticipation and the need that all small companies, that all researchers need to get in closer contact with standardization is very obvious in the near future.
Okay, thanks for that. Actually, I do see things speeding up a bit, but whether as much as we would like is another matter. Sorry, Francisca, you wanted to respond to what Miriam was saying, I think.
Yeah, no, I think that question was solved, but I have a follow-up question, if that's okay, and especially in terms of standards and the speed of standards. From a robotics company perspective, also for us, it's of course standards are very important, but they are also very often quite hindering, and it seems like innovation in hospitals, we've been trying to get for example, we have a disinfection robot. We are trying to get that verified through standards in the medical setting since 2017 now, and nothing has really changed. And it's really in a pandemic situation also hindering the robots that are helping to save lives to get into the hospital, because hospitals are saying, oh, but in our national standard it doesn't say anything about that we can use the UVC light for disinfection. So it's quite challenging, and my question is also a little bit, how can we evaluate the clinical value of these inventions, and how can we maybe speed up the process and also contribute to collecting evidence and getting that through a little bit more speedy, especially in a situation like this where this technology is so important?
It's a big question for Matthias. Do you want to give it a go?
Yeah, yes. So there are certain kinds of fast track parts. I saw in the chat already the workshop agreements from Senelec. We have a small subgroup, and you make a kind of pre-standard in a smaller group, not within years, but within months. And I think one of the key aspects I said before is getting involved as a company in standards in a very early time. So it's a kind of mission I do to really get interested that standards are not boring, that standards are very important for that.
We're trying on all levels,
yes,
but
yes. So there was a fast track for infection control and prevention in hospitals. So a standard or a series of standards which came up with under a year of work. And it's quite easy to include the new technologies in there and to get a common sense. Because if you are creating a robot, you are not creating it for Germany, or if you're not creating it for France. You need to create it for global access, and therefore standards are that important. And for these technologies, the speed of standard is much important. And if we come into the area of digital standards, we will see an enormous increase of speed in there.
Thanks very much.
I can promise, but I cannot guarantee.
Okay, we don't hold you responsible for CEN or for the ISO, but we're due to close very, very soon. I wanted to I've got a question actually for Beatrice, but I'll ask Eva first if there's more things that she would like to raise from the chat.
Well, there was this comment of the standard which is coming, but Matthias already mentioned, so maybe we can forward to some other thoughts you have in your mind.
Okay, well, in that case, I'm going to give Beatrice the last word in response to this question here. And obviously, it's also to be able to say thank you again for her being a speaker at a very short notice. So that's great, Beatrice, thanks. But in your presentation, you said, now, where is it now? I've lost it now. Oh, here it is. Companies report, or some companies, I should say, report what it's easy for them to report. Would you like just to explain that a bit more? Because obviously, it's a challenge in the world of measurement. Around, well, maybe there's an issue of trust and truthfulness here as well. So how can we get to a position whereby companies feel able to, or are going to be open and honest enough about reporting, so that the measurements that you would want to see made are going to be more meaningful. You use that word as well, meaningful, I think, as well.
Yes, the point here is that, I mean, okay, there's many tools that measure sustainability. And of course, there's few families, no? Labor practices and environment and all of this. And so, of course, they can report, they can go from one side better than the other one, or they compare companies to companies. But I think that the important thing is for community, for the society, and for the investors, and for their own good, for the companies, is to compare themselves in history, you know, so 1 year to the other one, and to see the improvement, because you want to know if you have improved, and everybody wants to know if they have improved, because you can compare two companies and they have the same score, for instance, of 50 points, but the year before this one was 33 and the other one was 60. So one is going down and the other one is going up. And this is what you want to know, the improvement, the application here of taking seriousness all of these aspects regarding sustainability, you know?
Okay, no, that's good. Thank you very much for that answer. This, of course, links with issues of trust. It links with standards.
Yes.
Maybe there's an implicit message to us all that we need to get involved in these agendas to make sure the ethical perspectives are taken into account as standards are developed and as guidelines are configured, if that's the right word. Okay. Now, I'm going to call the debate to a close there because we're even over time now. But before we close, I just wanted to say a big thank you to all the speakers, to all the people in the background that have helped make this webinar successful, and also to all people on YouTube and everybody else that is concerned with this agenda. Clearly, there's a lot of things that we need to pursue. We could have discussed for much longer. And I very much hope that you'll keep in touch with this agenda so that we can hopefully, in the words actually of, let me have a look. Matthias is boss, wasn't it? So we can be something about, wasn't it, about being true to our next generation, so we could answerable to our children and our children's children in the way that we take this forward. So thank you very much all, and goodbye.
Goodbye. Thank you to you.
Thank you very much, Malcolm. Bye.
Bye.